Hey, Mark, can you see and hear me okay?
Yep, no problem, Kevin.
Perfect, thank you.
Okay.
Morning, everyone.
Good morning, Councillor.
How are you today?
Not too bad. How are you?
Oh, not bad. Are you ready for another exciting edition of CPSC?
Good morning.
Good morning. How are you this morning, Teresa?
Good. I'll keep my microphone off because they're doing my roof and it sounds like there's a war going on upstairs or something.
Oh no. Is it bothering the cat? Is it bothering your cats at all?
They just want to be outside. They're just
Oh, that's
annoyed.
fair.
I'm not sitting outside, but it's really hard to.
Well, hopefully you're not disturbed
Adventure
too much by
continues.
it. Yeah, that's right.
Just to let you know that we are live now on YouTube.
Thank you.
Well, hello to the dozens of people watching us on YouTube.
We're into.
Allô, Pierre?
Bonjour.
Ça va?
Très bien, merci Marc.
Good.
Bonjour Marc,
Allô, Kim, ça va?
ça va très bien, merci.
Good.
Morning, everyone.
Good morning.
Good morning.
Do we have quorum, Mr. Coordinator?
Yes, Chair, we do.
All right, wonderful. We'll begin in about 30 seconds if everyone wants to be prepared. It's nice to see you all today on a beautiful day. I wish that we could be holding this meeting outside somewhere socially distanced. Perhaps at a splash pad that opens today. Well, good morning, everyone, and welcome to the Community and Protective Services Committee meeting of May 20th, 2021. I'd like to call this meeting to order. This meeting is being held remotely through Zoom, which is necessary in these times of physical distancing to keep everyone safe during the pandemic. Please note that those who do not need to participate in the meeting can also watch it on the live stream to the Ottawa City Council YouTube channel. A reminder to participants to please keep your microphones muted until I call on you to speak. I'll provide each committee member with the opportunity to ask questions or comment on each item in the order in which they raise their hand on Zoom. Committee members will be called on first, followed by any other members of council who have joined the meeting, and welcome to those of you who have. For panelists, the raise hand option is found at the bottom of the participants list. For attendees, you'll find the raise hand button at the bottom of your Zoom window. And for those calling in, please press *9 to raise your hand. The committee coordinator and I will be watching for those cues. The usual 5-minute speaking limit will apply. Members are also reminded to submit any motions, visual supports, and declarations of interest in writing to the coordinator at their earliest convenience. Although the deadlines have passed now for residents to register to speak to this committee, you may still make written submissions prior to council on May 26th. If you have any technical difficulties signing up for the meeting, you can contact the clerk's office at committees@ottawa.ca or by calling 613-580-2424, extension 28821. So again, welcome, bonjour à tous. I'd like to begin by acknowledging that Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia. Their culture and presence have nurtured and continue to nurture this land. The City of Ottawa honors the people and the land of the Algonquin Anishinaabe Nation. The City of Ottawa honors all First Nations, Inuit, Métis people, and their valuable past and present contributions. Je vous remercie de vous joindre à nous aujourd'hui. Nous devons examiner 3 points inscrits à l'ordre du jour. We have 3 agenda items to go through. The first being the annual report of the Ottawa Paramedic Services. We'll hear a presentation from staff about the work they did in 2020 to provide emergency medical response and out-of-hospital care to Ottawa's residents in an unprecedented year. Despite the constant pressure and significant public health challenges of COVID-19, paramedic staff have adapted to a rapidly changing situation to continue to meet the needs of the community they serve. In addition to providing emergency pandemic support, such as responding to outbreaks and vaccine administration. You know, as of this past weekend, 50% of adult residents in Ottawa have received their vaccine, largely in part to the incredible work of our paramedics. We'll also hear about a number of initiatives that they have been working on to reduce offload delays at hospital emergency rooms, including expanding community paramedic care, diverting patients from emergency rooms, and conducting proactive home visits. Nous examinerons quelques-unes des mises à jour administratives apportées au règlement sur les parcs et les installations. The changes proposed are not significant, but they update the language to better reflect the intent of the original bylaw, making it clear to understand and bring it up to date with emerging technology. These changes will help make sure the bylaw is relevant and reflects current practice. Et pour terminer, les membres du personnel nous offriront une présentation sur la version préliminaire de nouvelles politiques importantes, le tout premier plan directeur des infrastructures, des parcs et des loisirs combinés de la ville. So finally, we'll hear a presentation from staff about the preliminary draft of a major new policy piece, the first combined parks and recreation facilities master plan, something that has not been done since amalgamation. Places where residents can relax, play, and exercise are hugely important to the quality of life of our city. And as it grows and changes, all residents should have access to parks and recreation facilities. This plan is a supporting document of the new official plan, aimed at ensuring that we have the types of recreational facilities and parklands that we need to accommodate Ottawa's continued growth. Staff had looked at our current parks and rec facilities, consulted with the public, and analyzed data such as population projections and priority neighborhood needs to come up with recommendations that will support Ottawa's growth through to 2031. And as more data becomes available, these tables will be updated. We are not being asked to approve this plan today. This is a preliminary draft that staff will be consulting on over the coming weeks. The final report will be presented to committees and council later this year in September. La version définitive au rapport sera présentée au comité et au conseil plus tard en septembre. I'll ask that members and delegates please remain on topic when discussing this item, as staff will explain what this plan is about and, more importantly, what it is not. So let's move on to today's agenda. So I've received no regrets. Could the committee coordinator please call the roll? A reminder to members to unmute themselves when they are called.
Councillor Meehan,
Here.
Councillor Kitts,
Here.
Councillor McKenney,
Here.
Conseiller Fleury,
Bonjour.
Conseiller Tierney,
Présent.
Councillor Deans,
I'm here.
Councillor Kavanaugh,
Here,
Councillor El Shantiri, Councillor Dudas,
Ici.
Vice Chair Eglai. I don't see the Vice Chair. And Chair Luloff.
I think it's very apparent that I'm present as well. It's so nice to see all of you today. Thanks for joining us. Are there any declarations of interest? Seeing none. A confirmation of minutes. Are the minutes for the meetings of April 15th, 2021 confirmed? Confirmed?
Confirmed.
Wonderful. Okay, we will be moving on now to the Ottawa Paramedic Services 2020 Annual Report. We'll be asked to recommend Council receive this report for information, so I'll now turn it over to the Chief for his presentation. Please go ahead.
Mr. Chair, this is Kim Ayotte. If I may, as the acting GM, I'd like to say a few words before the presentation while they load it up.
Yes, please.
Thank you. I just want to share with the committee how proud we are of our paramedic service and the great work that they've done throughout this pandemic and that they've done historically. And through the leadership of our chief, you'll see that they've taken on new initiatives and have really moved the organization forward. I think this is a good news report, and I really encourage you to enjoy the presentation, and we're here to answer any questions. Merci à tous. Nous sommes très fiers du service paramédic et le chef Pierre Poirier. Et surtout, nous sommes ici pour répondre aux questions. Et aussi, nous sommes très contents du travail que tous les paramédics ont fait pendant les 2 dernières années et tous les années avant ça. Merci. Thank you.
Thank you very much.
Good morning, everyone, and welcome. And thank you, Chair Luloff. Merci, le Président Luloff. Today, I have a few comments with respect to our annual report. Et puis, je suis fier de vous donner un aperçu au service du paramédic d'Ottawa et de donner des informations sur le rendement, les programmes et les services de 2020. Just as a next slide, please, as a starting point, just want to highlight a few items, and COVID-19 had an overarching impact on all of our services in the last year. So I will speak a little bit about COVID-19 and its impact on our service, and I'll go through a number of other items with respect to our performance targets, offload delay, community paramedicine programs, and a look ahead into the future here. Next slide, please. COVID-19 absolutely was a significant event for all of us. And I just wanted to note a few items with respect to how it impacted our service in particular. With respect to staff, and just to give you an idea that over 50% of the individuals that were screened positive by the service, which really had a significant impact on how we work in a day-to-day format. Unfortunately, some of our staff did contract COVID-19. None of them resulted in any harm to any patients. And I'll talk a little bit more about that later. And what happens is that when our staff has contracted COVID-19, it resulted in them being in quarantine or isolation, which had a significant impact on our ability to provide service. And just to give you an idea, there was about 38,000 hours of time in isolation over the last year. With respect to our operations, and you've probably heard me say it before, the idea of time on task, both in the communication center, where the algorithm by which we ask callers questions was lengthened. And then for our staff, because of the PPE that was required to respond to these patients, they had to don and doff gear. So that was gloves, their masks, face shields, gowns. So that all added to our time on task. Impressive in terms of how the paramedics were able to cope with this. The next item was with respect to the actual PPE, and you've probably heard of the supply chain issues with respect to global shortages on gloves and N95 masks. It had an impact on our service, and I'll talk a little bit more about that later, particularly when we talk about N95 masks. And just a good note on the N95 masks is that we have been in the last month or so receiving quantities and shipments where we're able to no longer use expired masks. And then the last piece is a good and bad scenario is it did reduce our call volume, which was impactful, particularly the period between April and June. And I'll talk a little bit more about that later. Call volume did come back over the summer, and then as the second wave hit, it decreased again. Next slide, please. This is an important review of our call volume. If you were to take 2019, we averaged around 12,000 calls a month. In 2020, you could see that earlier in the year, we were at 12,000 calls in a month. But by the time the province announced their declaration of emergency, in March, we were down to 10,000, and then just around 9,000 in April. Over the summer months, as we relaxed the restrictions related to COVID, once again, our call volume came back, and as the second wave hit, our call volume diminished as well again. Some of the questions have been, did people stop calling for the paramedics to arrive and provide care? Anecdotally, there is some of that because early on in COVID, there was this perception that hospitals or going to the hospital is not necessarily a good thing. We will continue to monitor our call volume, and I can talk a little bit more about that in looking ahead. Next slide. So over the last number of years, the paramedic service has really had a set of benchmarks by which we measure our performance. And the benchmarks here before you is that the good news is that we've made our targets, and we made the targets in a healthy way. The interesting piece there is that on our most important calls, we're just at the target, where our belief is that we can still do much better in that area with respect to the life-threatening emergencies, both the the ones and twos, and that refers to an assessment of the patient by the paramedic in terms of their acuity and with respect to their health needs. So we did meet our performance targets for the paramedic service. And on the next slide, you'll see that there are two other benchmarks that are noted with that we talk about, CTAS 1s and the sudden cardiac arrests for the communication center. So the paramedic service, we have our performance targets, and the communication center also has performance targets, and they were also able to meet those two performance targets. The important issue with respect to sudden cardiac arrest is 6 minutes for the paramedic service, and then it's 2 minutes for our communication center to be able to dispatch that call. Next slide, please. Last fall, I think I was new to the position, and I had a few hours notice that I'd be presenting the annual report. And there was a healthy discussion on the topic of offload delay. And where we were at in 2020 was that offload delays throughout the summer and into the fall had become a significant problem. And it's not a new problem. It had exacerbated. The healthy discussion with the CEOs of the hospitals, we were able to continue looking at collaborative efforts to do better. Overall, I'm happy to report that there has been a significant improvement, and from 100 minutes to 70 minutes for the two largest hospitals. The Queensway also did improve. Unfortunately, the Montfort had more challenges, but you can see that overall our numbers are below 80 minutes. And I don't want to give accolades as if this is a problem solved. Absolutely not, because the important piece here is that 30 minutes is really our target time, that the transfer of care, the time from which a paramedic arrives at the hospital to the point at which the hospital assumes care for that patient should be less than 30 minutes at the 90th percentile. We are not meeting that target. And I'll talk more later about what we're doing to improve that. There has been improvement, but we still have a lot of work to do. Next slide, please. And this, like, you know, sometimes you hear people say, what keeps you up at night? And this slide represents something that keeps me up at night. Offload delay has a significant impact on our service. And I'll often see information that comes my way that we have 15, 18, 20 paramedic units at hospital. And when they're delayed, what happens is that in the community, we may no longer have a resource to provide that service to the next priority call. And that really is of great concern. You'll see that there was a decrease in the number of level zeros, and that's the point at which we do not have a paramedic unit available to transport somebody to the hospital. The number came down from, we'll say, 50 a month to 40 a month. That is an improvement. The objective here, once I really want to communicate, is that our objective is that this never happens. There were over 200 hours last year of not having a paramedic crew available to transport someone to the hospital. Our objective is 0 on this element. So lots of work to do. The reason I presented after the offload delay is that these two items are absolutely well correlated. And we can do better, and we'll work with the hospitals to achieve that. Next slide, please. So last fall, we talked with the counselors, or sorry, with the CEOs of the hospitals. And part of that discussion is, well, let's work together and let's report back on that. So I'm happy to report on a few of the items. The first item was the offload and medicine transport unit, also known as the OMTU. It's the big dome that was put in place beside the civic campus. There are 40 beds in that campus, in that facility. And I can report that it has had an impact, but it did not start operation until 2021. So I'll be able to report back on that at future meetings with you, Chair and councilors. I think it's an important piece that adds the capacity. The second item is a patient distribution system. So even prior to the meeting with the CEOs last fall, staff with the paramedic service were engaged with the hospitals to say, what can we do better to help support the system as a whole? And the PPS trial has just started just recently. And the discussion there was currently, or the system in 2020 was that for every 2 patients that went to the civic or to the general, 1 would go to the other 2 facilities. And this was done without respect to how busy any of those hospitals were. So it was very much a blunt instrument of saying, oh, okay, we've only sent 1 to the MOFOR, the next one has to go to the general or the civic. Even though the MOFOR may not have anybody in the waiting room, they may be able to provide service to the next patient. That old system needed a revisit. And that's been done. In March, beginning of March this year, we instituted a system that looked at where is their capacity to accept this patient. So it may have increased our drive time on occasion, but really what it is doing is bringing to the patient to the hospital where there's a capacity to deal with that individual. So another item that I'll be looking forward to talking more about in future meetings. The third item there is community paramedicine programs. And the overall concept, and we have several initiatives in this area, is to look at how can we reduce the number of 911 calls, or how can we reduce the number of patients who end up in the hospital. I think most of us would agree that if I had a healthcare need, I prefer to have that healthcare need met in my home. And why not? That's the place I'm most comfortable. Why should it be always at the hospital? And paramedics are uniquely trained and able to provide that care in the hospital. So I'll talk a little bit more about that. Next slide, please. So when I talk about the community paramedicine programs, here are 4 recent initiatives. The High Intensity Supports at Home is a program that conducts home visits to clients with high or complex medical needs. This program is funded by the Ministry of Health. We received funding in late 2020, which continued until March this year, and we expect to receive more funding. We continue to provide this service. We're hopeful that the ministry continues to fund us for that. The second item there is the long-term care program. Minister Fullerton announced last fall this program for several services across the province. We were the recipients of $10 million over 3.5 years. So we're expanding that program bit by bit. It really is an important program where we look at supporting older adults who are waiting for or are eligible for long-term care facilities, that we can maintain their healthcare needs or support their healthcare needs in their home while they're waiting for that long-term care bed or the placement in long-term care. So it's really another important initiative that allows people to stay in their home. The next item is a partnership with the West Carleton Family Health Team. This has been going on for a couple of years. It's located in Carp. It's been an effective tool where we've brought together health professionals and paramedics check in on individuals in the surrounding community to help them stay safe at home and to provide their healthcare needs. The last item on that list was the palliative care trial. It was announced last year and then announced again early this year. We have an official start day of May 31st. It was set to go last summer. This program is really, I think, is a program of compassion, that individuals who are end of life may need care for pain management, for nausea, and arguably there is no good reason for them to go to the hospital. But historically, they've always ended up, when they call for 911 for help, they end up at the hospital. So this program will allow paramedics to provide the appropriate care in their home, so at the right facility when they need it, and also not have that individual end up in the medical system at the institution or at the hospital. So the last slide I think is important with us looking ahead. The first item there is our West Deployment Facility. The current facility, our headquarters on Don Reed Drive, was built in 2005. It is busting at the seams. We have, for our operations, we're lacking space. For our staff, we're lacking space. We're at the point where we absolutely need a new facility. And we're working with city services to find a location, also to find a process by which we can build a new facility. There'll be further reports coming back to committee and council, particularly because there's an interest in a P3 model. And the reason that I note that in the report—
Mr. Chair,
Sorry.
Yes.
sorry, it's my system. I apologize.
Okay, please continue, Mr. Poirier.
No, thank you, Chair. Just to continue on with respect to the public-private partnership, the idea here is that we would follow the P3 policy, and I've been in discussion with Will McDonald in Supply Services to ensure that we follow an appropriate process. The current facility that we have at Don Reed Drive is a P3. The unique element in the argument for a P3, I mean, there's significant work to do in terms of a business case analysis, but what makes our situation unique is that if the city chooses to build a facility on their own, we would be paying 100% of the cost. But if the city engages in a P3 model or in a lease model, then the city pays 50 cents on the dollar and the province pays the other 50 cents. So there's more to come on that issue, an important discussion piece. The second item is our response volume. There is a strong correlation between population and response volume. And post-pandemic, we expect that within 3 years, by 2025, our call volume should be back around 160,000 calls. And that's an additional 27,000 calls that we would be responding to. So that's kind of an important piece that we're planning for the future and understanding that there will be growth and there is a real need for our service in the community. The mental health, in 2017, presumptive legislation was passed by the province recognizing PTSD as a workplace illness. And the Ottawa Paramedic Service and the city as a whole has invested significantly in mental health and mental well-being of staff. An important initiative, the Ottawa Paramedic Service, I think, has been a leader in our community. We have 45 individuals who are part of a peer support program. And really, it's kind of it's not, I'd say it was novel when it was started. You're seeing many people replicate this idea, is that when paramedics have something that's stressful that happens in their work life, it's best that they have a peer to talk to. And it's a great initial piece to help diffuse, mitigate, to understand the complexities of our work life. Because you're talking to somebody who has a similar experience and who has knowledge of what you may have gone through. We continue to work closely with the Royal Ottawa. There's several other initiatives coming forward. And where I mentioned the mental health response team is an important initiative that we're starting to see for the benefit of the community. I'll say, and this isn't necessarily directly for the benefit of staff, is that I hope to bring forward a report later this year on the idea of establishing a mental health response team with a paramedic and another allied health professional attending and addressing calls in our community where the paramedic and the other health professional can provide the appropriate healthcare navigation, education on how to best deal with these calls in our community to support the well-being and mental health of individuals who may be calling for assistance. So I look forward, I'm excited about bringing that forward later this year. And the last one I mentioned, community paramedicine program, is just to give you a narrative of how does this work. If I use the West Carleton Family Health team, we have a paramedic who works with the healthcare team, which includes nurses, doctors, a physiotherapist, long-term care, and sometimes even the retirement home manager. Recently, an individual was in a retirement home, was looking unwell. The individual is reticent about seeking professional help, but had a positive relationship with the physiotherapist. The physiotherapist introduced a community paramedic to the individual. In a short period of time, they developed the relationship such that the community paramedic was able to gain the individual's confidence. Thereafter, the community paramedic was able to perform a medical assessment and provide care, medical care and treatment. And this was all done in the home. The individual was pleased to say that at the retirement home, not to be transported to the hospital, because oftentimes that's a significant fear for individuals. And what happens in that small kind of vignette is that, you know, the individual in question received the right care at the right time where they wanted it. And when we look at it, it's a benefit to not just the individual, but the healthcare system as a whole. So thank you for your time, Chair. I'm prepared to answer questions.
Thank you very much. So seeing that we do have some questions here, we'll begin with Councillor Dudas. Councillor Dudas, please go ahead.
Thank you very much, Chair. Thank you, Mr. Poirier. I was absolutely flabbergasted by the amount of work that our paramedics have done. You know, I was impressed by them prior to the pandemic, but the fact that they've undertaken all of this additional work and stress on themselves throughout the pandemic has been phenomenal. And the fact that they've been able to maintain the legislated and council directed response time performance standards is phenomenal. You mentioned in the report, you mentioned during your presentation that throughout this pandemic that our paramedics have risen to the occasion. They've taken on a lot of these additional responsibilities, whether it's working at the assessment and swabbing centers or the special population response team. And you alluded in your last slide to the mental health response team and the report that you're going to be bringing forward. But I actually was hoping that you could elaborate a little bit more, because once again, our paramedics from the beginning of this virus coming to our city have been on the forefront. There's been a lot of evolution in terms of information from our medical health officials, from various levels of government about different interactions with the virus. And I was really curious from your perspective about how morale is within our paramedic service, about the mental health services they've received so far, if they're feeling supported by council, by the community, by their management, because once again, we need to make sure that they're strong and healthy so that they can continue to do the work that they're doing for our community.
Chair Luloff, thank you for the question, Councillor. You know, in a word, I'd say that the paramedic staff is tired, and collectively we're tired. But that hasn't stopped paramedics and the whole team here of doing their job and doing it well. The second piece that you mentioned was with respect to morale, and it's an important piece to recognize that paramedics in our engagement during swabbing and particularly during the vaccination process have been incredibly encouraged by the overwhelming community support they've received. And I can say that uniformly, whenever I've spoken to a paramedic who is vaccinated an individual or who's been involved in the dilution of vaccine, that there's a sense of pride in what they do, but there's something that fills the soul when they're able to have somebody say to them, you know, thank you, you saved my life, or just a thank you for doing what you do. So the morale, as much as individuals may be tired, really has been improved significantly because of that feeling of contribution to the community, and contribution on a one-to-one with not somebody who was a patient at the time, but somebody who was asking for a service and you're able to provide it. So that has been an incredible replenishment of the soul for individuals and for our paramedics and for the service as a whole, because it's been a whole service initiative. And then the last piece you mentioned about the feeling of being supported, and I think that is there. And the reason that I may have hesitated a bit is that I think we can still do more to support the paramedics and support their mental health. And we continue to look at initiatives, and we've been working with the Royal Ottawa to understand better moral injury, to understand better how we can develop and support, and I hesitate using the word resilience, but to make them better prepared for the day-to-day. So thank you for the question, Chair and Council.
And Mr. Poirier, and I won't put you on the spot and ask you about what do you mean when you say more support, because I know you're bringing forward that report, and I'm hoping that that's where you'll elaborate on that, because I think it's more than just yourself and your management team providing it. I think it's council as well too, and the community at large. Because we know with our paramedics, it's mental health, but it's also the physical strain on their bodies. It's the impact on their families. Like, it is extensive, and that's in the normal daily regime, let alone in a pandemic. So when do you anticipate you'll be bringing forward that report on the mental health response team?
Through the chair, thank you. We intend to bring the report before year end. And I'm hoping that we could still meet Q3. Following this meeting, that is one of the priorities for the service, is to work different elements. And when I talk about the mental health support response team for our community, part of our alignment is to ensure that we have the appropriate discussion with the community safety well-being plan, because it's not us doing this in isolation. This is us doing it within the broader community. So everyone from law enforcement services through to the Royal Ottawa and mental health services, that I think we have to bring forward very much a coordinated approach and an appreciation that I think the fantastic work has already taken place in the community safety well-being program will very much inform how we proceed on this issue.
Wonderful. And I assume that although the report will take some time to draft, the work is in progress. You're already providing supports as you find them and as you see fit.
That's correct.
Okay. Well, I want to just finally reiterate my heartfelt gratitude to our paramedics. I mean, they are phenomenal individuals who have taken on a job that provides probably immense satisfaction, but a lot of strain as well. And I can't imagine what they face every day. I had the privilege of joining a team on an overnight shift long before the pandemic, and that was exhausting for me. I don't know how they do it. So it's absolutely phenomenal. They're superheroes in my eyes, and as are all of our first responders. So thank you, Mr. Poirier, and thank you for this update on their incredible work.
Thank you.
Thank you, Councillor. Councillor Fleury, please.
Merci, Monsieur le Président. Good morning, Chief. Thank you for the extensive presentation. Lots to absorb and lots of consideration in your work. And I want to begin by thanking you and the entire team for pivoting and responding and always being there. It was amazing to see the team there for long-term care and vaccination and continuing throughout. So testing and vaccination it just shows the resilience and the ability of your team. So want to begin with that. Pierre, j'ai quelques questions au niveau, quand on regarde les délais, tu l'as bien souligné, il y a des délais, puis il y a des coûts financiers à ce délai-là. Il y a des coûts sociaux à ces délais-là, tu en as parlé, mais il y a aussi des coûts financiers. Tu avais chiffré un nombre d'heures, ce qui attribuait tout près de 6,6 millions de dollars. Puis, je me questionnais aussi, tu sais, nos staffing levels, puis notre overtime, sans penser au offload ou les mettre ensemble. Peux-tu nous donner un aperçu? Je sais que la période de pandémie a créé peut-être une zone tampon là, pour les considérations, mais où est-ce qu'on s'en va? Je sais que l'année passée, on avait engagé un nombre de paramédics. Quels seront les besoins dans la prochaine période budgétaire?
Merci, le Président. Les coûts c'est assez gros, à 6 millions. Sur l'autre sujet de l'emploi puis des paramédics à temps plein, on a eu 14 pour l'année 2021, puis encore en 22, il y en aura encore un autre 14. Ça, c'est au temps du conseil. Pour nous autres, c'est l'isolement des paramédics quand il y a quelque chose à COVID. Puis ça, c'est quelque chose de sérieux en nombre de, je pense, c'est 38 000 heures de temps perdu. C'est quelque chose de même, le président, qu'on était capable de gérer. C'est pas toujours facile, mais quand même, pour l'an 2020, on était capable à gérer le temps de COVID puis l'impact sur notre équipe.
OK. Je suis rassuré de voir qu'on a un plan de continuer à augmenter. Sur le même sujet, mais relié plus au niveau statistique, quand on regarde le tableau CTAS, là, puis ça fait quand même plusieurs années qu'on en discute, pour une année qui a été différente là, au niveau de nos réponses puis au niveau du volume, c'est quand même inquiétant là, quand on est encore. L'objectif du conseil, c'est 75% pour les CTAS 1. Corrige-moi si j'ai tort. Puis on est juste à 75,7. Alors, on est à point quelque chose là, d'être en dessous des objectifs du conseil. Pourrais-tu commenter sur ça? Je sais que pour l'instant, on est encore atteindre ces objectifs-là à 8 minutes ou moins. Mais j'aimerais ça avoir peut-être ton aperçu de ce que ces statistiques-là signifient pour toi.
C'est quelque chose qui me concerne. Pour l'année 2021, on espère toujours que COVID et que la pandémie se résolve, qu'on n'est pas toujours dans des enjeux au sujet du pandémie. Présentement, pour l'année 2021, je pense bien qu'on sera capable d'atteindre nos rendements qui sont spécifiés à 75%.
Okay. Puis, maybe final two questions here. On the reporting of hospital off delay, I noticed there's one missing, which is the CHIO. I wonder why we're not including CHIO data.
Good question, Chair. The reason we don't report on it is not that we don't track that. We absolutely do track our offload at the CHIO. The short answer is they perform well and they easily meet the 30-minute offload time at the 90th percentile. Arguably, I think it's below 20. And if anything, they are the role model for the rest of the adult hospitals in our community. And they've consistently met that performance over the last number of years. So that's why we don't mention it in the report.
It's reassuring to hear that. I think we should include it. I don't know if that's a direction that could be captured here, that good and bad, we want to see in the annual report some of those, because it does give confidence to residents and gives the good examples. On the COVID note, two streams. One, you talked about transmission and some of those challenges. Can you give it a bit more, like as an employer, are you confident we've done all that we could to make sure that our first and foremost, our team is safe throughout, and that when we interact with patients, that's continued? And I heard you talk about equipment. I heard you talk about sick days and so on, which is very important. But from a kind of council perspective here, can you assure us that we've done all that we could to protect our staff, and that we've continued to adapt those measures as information's become available and equipment's been made available?
Thank you, Chair. And good question, Councillor. Our ability to provide service is a credit also to, I'd say, the internal mechanisms that we have with the organization. We have a regulatory compliance infection control officer within our service. Incredible value to our service. Early on in the pandemic, and I'd say right at the beginning of the pandemic, we instituted a program where first we shut down our facility to the public, not because we didn't want the public, but because of a safety measure. And then we instituted a whole program at the very beginning of taking the temperature and having the questionnaire answered every time a staff member comes to work. And I think some of the counselors have actually gone through that process at our facility. And that has really kept our facility safe. So that's part one. Part two is, and a credit to our relationship and our infection control officer, we're in regular discussions with Ottawa Public Health, and they've been an excellent partner in terms of providing a quality service and a good information source so that we can communicate to our staff. So Ottawa Public Health has been an invaluable resource and partner as we have really been able to keep our staff safe. And then the last piece is, the process of understanding that if there is a contact, and we've done that assessment with, once again, public health to assess what that contact is. And we've been, I would say, ultra cautious in asking people to stay away from the workplace until the 14 days or until they're healthy once again. And our total for the number of, and you can take this in the context of around 700 staff at the paramedic service. In 2020, we had 17 contacts, but none of those were related to where we received it from a patient. Our contacts were, somebody off at home, somebody in the community with somebody. So we never had to say that we were concerned that one of our paramedics was a vector in terms of COVID going outside of our paramedic service. So we've taken this very seriously. Credit to the staff who have responded appropriately and have shared in that and recognized how important it is in the, putting on the appropriate PPE, maintaining the PPE. And the donning and doffing has been quite a chore for paramedics, but they understand the importance. And we're proud to say that, that we've been contributing to the healthy community.
My last COVID question, my second piece, and my last question, Mr. Chair, on this matter is about the opioid crisis. We saw CBC release the data for the opioid and deaths today, doubling at 123 in 2020. Yeah, your team's on the front line of that, responding with naloxone, responding to those overdose deaths. Can you speak to us about that? I think I hear it from Ottawa Public Health. I hear it from those that work in the community health fields, but I haven't seen the face of paramedic as we've seen, for example, in Vancouver, and yet the opioid crisis is a very serious issue in our city.
Thank you, Chair. The opioid crisis has absolutely touched our community. In 2019, there was a lot of discussion in the media, and it was an issue and a topic of concern. Unfortunately, COVID has kind of pushed the opioid crisis out of the front lines or the front pages, but it didn't go away. And paramedics regularly see those individuals who are impacted by it. And one of the things I can report on is that in the last couple of weeks, I think the beginning of this month, we instituted a program in concert and in cooperation with public health to provide naloxone kits in the community. And that was very specific to saying we're providing these kits in the communities, no questions answered. So if a paramedic sees somebody who may be in need, offer them the kit. I don't need to see your health card. We're not trying to stigmatize this. We're doing everything we can to promote harm reduction and to not stigmatize the need or the request or the want for a naloxone kit. So that's been well received by paramedics in the last couple of weeks. And we continue to promote the concept of harm reduction in our community because it is something that is, it's much like we talk about motor vehicle collisions as being avoidable. There should be no deaths related to opioids or overdoses. Thank you.
Thank you, Chief.
If you want to wrap up, Councillor, that's your time.
Thank you, Chief.
Great. Up next, we have Councillor El-Shantiri. Please go ahead.
Thank you, Mr. Chair, and Chief. Thank you to you and your staff on job well done. It's not just during the pandemic, but every day. And I was interested when we talk about the community paramedicine, and I know the role they play, or the important role they play, especially in area like West Carleton and the geography we have, so, but it seems every year or every 2 years we have to go back and negotiate the funding and ask for the funding. Like, is there a way we can at least have a long-term funding for the group, so we don't have to every year or every second year start negotiating all over again?
Chair, and thank you for the question. The answer is yes. We've been in discussions with the province to move the funding from a project to a program. Interestingly enough, we're now working with 2 different ministries. The funding we got, the $10 million we got for long-term care, was through the Ministry of Long-Term Care and Minister Fullerton. The funding for high intensity programs is through the Ministry of Health. The funding for the healthcare team, the Ministry of Health at present. We're absolutely in discussions, and the province has brought forward a paper on how to, or an application process to look at how to make these part of base programs. And we are absolutely committed to the concept of a base program funding. So it'd be part of our annual funding model, as opposed to, well, where we're at right now with the high intensity program is the funding ended March 31st. We're continuing to provide the service, and we have a verbal promise from the province that yes, we will give you more money. We're looking at, and we continue to advocate for base funding. And I truly believe that it will be there. And what's happened over the last several years is that the province and the Ministries of Health and Long-Term Care are seeing the benefit of community programs and how well they're being received in the community.
And so I know we have them in West Carleton. So do we have them anywhere else in the city, the paramedicine? Because they deliver a great job. And I remember, I think a couple of years ago, they estimated they reduced the call for ambulance by 29% in the area where they work. And it's not just in the city of Ottawa, because it was a pilot in other part of the province. So if the benefit so great to reduce the call by 29%, does it take a genius to figure out this is a good program and we should fund it permanently? Like, where are we failing to make the case?
I'm not sure where we're failing to make the case. I think the province does have an appreciation for the value, and that number that you mentioned, Councillor, and through the chair, is appropriate. That we see significant reductions in the number of calls for 911. We have several other initiatives. So as Ministry of Health transitions to their new Ontario Health team, we have engaged with everyone and I think there's 140 different partners, over 100 partners in the Four Rivers Ottawa Health team that's in the West Carleton and west of the city. We're also part of an East Ontario or East Ottawa Health team. And we're looking at expanding all of our programs, and really with in the simplest form, it's let's figure out ways that we can provide care at somebody's residence, be it a long-term care facility, be it a retirement home, or be it their individual residence. So we continue to advocate for that, and I do think that the province is hearing us on that subject.
Okay, thank you very much, Mr. Poirier, and thank you, Mr. Chair.
Thank you very much, Councillor. Up next, we have Councillor Meehan. Please go ahead for 5.
Good, thank you, Chair, and good morning. And Pierre, I will add my thank you to all the paramedics and all the great work they've been doing in the community. I wanted to ask a question about the offloading issue at the Ottawa Hospital. You said that I guess the dome that has gone up with the 40 beds, it's just started to have an impact. Can you see a trend at all? Is it going to reduce the amount of time that the paramedics are going to be waiting there? Is there some reason to be optimistic? And I apologize for asking this if Councillor Fleury has already touched on the topic.
Chair Luloff and Councillor. Councillor Fleury hadn't asked this question. That facility at the Civic, we don't have the hard data at this time, but anecdotally we've noticed that it has improved our offload times, and we're very much encouraged by that facility. As much as it opened in early January, they had their difficulty staffing it. So as it's staffed up, we've seen an improvement in our offload at the facility. And arguably, I've been advocating in support of the Cameron Love and the CEO to have another one built at the General.
Yeah.
Because the General, and we often compare those two facilities and say, historically, we'd say they're both bad. I would honestly say optimistically, the Civic has improved. And I'm optimistic if they were to receive funding for a similar facility at the General, that I'd see the same impact. Our premise has always been this is a hospital problem, but they're not in isolation of the community. So I'm prepared to advocate with them to find ways that we can improve the overall offload times.
Okay, so you haven't done that yet. So we're going to be doing it then?
I've been in discussion with Cameron Love and saying that I absolutely will advocate on behalf of that.
Excellent. Yeah. Can you remind me, is the dome going to be there 360, or is it going to be, is it temporary? I can't seem to remember. I'm
not sure if I can be quoted. I think it had a funding envelope of 5 years or 7 years. But I can get back to you on the exact detail regarding that, Councillor.
Okay, but I mean, I realize that after COVID's over, the response, I guess the demands for service you expect are going to increase. So if you're just meeting targets now, especially on the critical cases, we're going to have to look at more resources, right, to fund the paramedic service.
Through the chair, my understanding is that our call volume will return post-pandemic, and I think most people do agree with the concept that life will strike a new normal, but people will be mobile, people will continue to move around. This term of council has been gracious in supporting the paramedic service and the 14 paramedics that we've gotten each year. I intend to, and the group intends to look at our call volume, our response times, all of our metrics, and we will be coming back to council in the coming years with a report on that subject. Okay.
So just rounding the circle here. So when do we expect to see some data then on the dome, the 40-bed dome at the Civic?
Chair, I could do it as part of an annual report, or I can bring it forward earlier at your direction. The Ottawa Hospital has absolutely been a good partner in discussing and talking about how it can work and how we can improve its operation in support of our activities. So I will take direction from committee and council with respect to the timeline.
Okay. But it looks like it's encouraging. I guess it may be paid to sit down with the CEOs. Okay. Mr. Poirier, thank you so much.
Thank you.
Thanks, Councillor. Moving on now to Councillor Deans, please go ahead.
Thank you, Mr. Chair, and good morning, colleagues. And Pierre, let me add my thanks to you and the entire paramedic team for the important work that you're doing in our community. I have two areas that I want to discuss this morning. The first one is the need for the West Paramedic Headquarters. I recall when we entered into the P3 for the current paramedic headquarters with on Don Reed Drive, and I do recall that we oversized that facility. It was kind of like an empty shell when we got it. It was so empty, but we built it for the future, and we built it for the anticipated expansion of paramedic service. So I'm kind of stunned that we're so quickly at capacity. So I'm looking for an explanation on how we got from what we anticipated would be a long-term facility that would meet our long-term needs in this city to where we are now.
Thank you, Chair. I was involved in the construction of the facility going back to 2003 when we were working with Régent Chartrand in the P3 office. Initially, this facility was built or was spec'd to have a 30 to 35 year life. And early in the, I'll say somewhere in the process, we went through a value engineering process, which improved the overall facility. But we also reduced the budget by 25% in that at the early on. So we recognized that when we built the facility, we had shortened its life. Part two is that the growth that we thought, and you referenced that the building was empty at one point, or not empty, but not to capacity. I think, and and don't quote me maybe on the numbers, but we had less than, I'd say, 100 vehicles at the time, and around under 500 staff. Today, with also with the hiring that we've done in recent years, we're over 700 staff, and we're up around 140 vehicles. So you can see how, everything is kind of crunched. The boring story is that we started with lockers that were from floor to ceiling. We have them, and now we have people in shared lockers. So it really has been a significant change for us operationally. And that's kind of the history of how we came to be a full facility that really does need something to augment our capacity, but also to, from an operational point of view, to start to balance the city east and west. So thank you, Chair.
Okay, and is there, I mean, I understand what you're saying about balancing the city east and west, but I mean, that location was chosen for its central location, being able to reach all of the regions of the city of Ottawa. So is there potential for expansion of the current site, which would sound to me a lot cheaper than building a second complete facility?
Thank you, Chair. This facility is full in terms of the physical structure, and also the land that we occupy is full. When we first spec'd what we needed, recognizing if we were to use that 30-year time horizon, that we would have needed upwards of 10 acres. And when we put the two sites together on Don Reed, it worked out to being something around 8 acres. And over the last number of years, we've made small improvements to capture more of the land, either for parking or for other services. So we've actually kind of consumed all of the green space, unfortunately, within the site. So there's very little space that's actually available. Also, in the initial construction concept, at one point there was a thought of building it so that it would be capable of supporting, say, building up. But that was also removed as we changed the initial program for this facility.
Okay, thank you for that. The second thing I want to talk about is your comment right at the end of your presentation when you said that we can anticipate you'll be bringing forward a mental health strategy this fall. And I'm concerned about that. And the reason I'm concerned, I mean, obviously we need a mental health strategy. I think it's become increasingly clear that our mental health effort needs to change, needs to be coordinated, it needs to be inclusive. And I chair the Crime Prevention Ottawa Board, which is the advisory board for the Community Safety and Wellbeing Plan. And what has become increasingly clear to me over the last number of months is that we need the city to take a lead on a coordinated mental health strategy that brings together all of the parties across the city. So brings together health and resource centers, community partners, paramedic service, police service. All of the players need to be at the same table developing one strategy. And I think that needs to be under the tutelage of Anthony DeMonte as the general manager of the department and Dr. Etches as the chair of the Board of Health. And I know those are two of the busiest people in the city of Ottawa right now. I know that. But I think what I see emerging in the absence of that coordinated effort is all of these individualized mental health strategies, a siloed approach popping up. So paramedics will have a mental health strategy. Police are leading a mental health strategy. And I don't think any of us should be leading the health strategy. I think it should be led by the city, and it should be coordinated, and it should bring everybody to the same table so that we develop one strategy, not pocketed strategies across the state, because that's confusing, it's disjointed, and I don't think it's going to serve the community as well. So I'm wondering if you could comment on how you see us actually coordinating a mental health strategy.
Through the chair, and in my presentation, I did talk about the Community and Safety Wellbeing Program. I didn't mention that as we started developing what we were doing, it was to ensure our alignment with that. And also Anthony DeMonte has spoken with Chief Slowly just to mention what we were thinking of doing. So as you know, what we're working on matures, it absolutely, my intent is that it be coordinated in a broader sense to what you're speaking about, Councillor. And I believe that's a very important component, that we don't piecemeal this and then end up with something that doesn't benefit the community in the proper way. To balance that, you know, our belief here is that there's a sense of urgency that something has to be done. And that's kind of how do we find that perfect mix? You know, I would argue that I don't think it's appropriate to wait 5 years for us to have the perfect strategy. In some ways, if we could get something up and running in 2021 that's imperfect but good, hopefully we can find that balance and make sure that we haven't done anything that isn't coordinated. So I absolutely appreciate the comment. And my commitment is to work with community safety, well-being, and their priorities to ensure that we're not out of alignment. Because I think even today we could do some small things that benefit the community as a whole, that will not be that will contribute without displacing or duplicating an effort that's being done somewhere else. You know, an example right off the bat is if there's a way that through our communication center that we can identify some of those calls that may be appropriate for a mental health response team, could we maybe go to those calls? We're not solving all of the problems in the city, but we may be solving some of them. So I'm absolutely willing to engage in that discussion. You know, when talking with GM DeMonte, was to make sure that we start the dialogue and that we are coordinated in our effort for the community as a whole.
Well, thank you for that, Pierre. And I understand exactly what you're saying. I don't disagree, except I believe this mental health strategy needs to be coordinated under the umbrella of community safety and well-being, and that it needs to be led by the city, and all the players need to be there so we get this right out of the gate. And I don't think it has to take 5 years at all, but members of committee, I think it's up to us to make sure we're giving direction to the staff to bring the right people to the table to develop a coordinated strategy, not a siloed strategy. And I'm very concerned that what we're going to get is a siloed strategy if everybody's off doing their own mental health strategy. And I really think that public health and community safety and well-being need to be the leads that bring everybody together to one table to sort this out and to work together to develop a strategy. And Pierre, I'm on your page with, we need to get this done now, not 5 years from now. Totally agree. But I also think that all the players need to be there so we're not tripping over each other every time there's a mental health call in this city. And I'm really concerned that that's where we're going right now if we don't get this right. And so I would really encourage, I don't know if we need a motion. If you want me to write a motion, I'll write a motion, but I really encourage that we ask Mr. DeMonte and Dr. Etches, their departments to lead a mental health strategy under the umbrella of community safety.
Point of order, Mr. Chair. I understand what the councillor is saying, but not to put too fine a point on it. Council and committees do not direct Dr. Etches and the public health department and how they proceed. Certainly as the chair, I'll share what I've heard today with them, but just so we're clear, it's a separate body and that's how it operates, kind of like the police services board, which can't take direction either.
I'd be happy to kindly ask Dr. Etches, as I would ask Chief Slowly, and we certainly can ask Mr. DeMonte to lead that effort. And my point is that we need to get this right, and we need to get the right people at the table, and we need to get the right people leading this effort.
And I don't disagree that the committee could.
This isn't a debate. That's not.
I'm not debating with you. I'm saying I agree.
Hold on. Order, please. Order.
I raised a point of order which hasn't been responded to by the chair yet, and I wasn't going to disagree with you, Councillor. I was going to agree with one of your points actually, but I'll be quiet and let the chair speak to the point.
Councillor Deans, I think that it would be appropriate for you to work with the clerk to prepare a motion asking GM DeMonte to work in concert with his partners, the two that you have identified, to prepare a comprehensive mental health strategy at their earliest convenience. Something like that.
Okay,
I'll let you work on the wording.
That motion to council. Thank you.
Okay, that sounds good, and I appreciate that, and I do support that. I think that it is important that we take a comprehensive approach. This is exactly the kind of work that I was trying to do, or am trying to do, with the Veterans Task Force. We want to ensure that disparate groups that are providing different services are taking a comprehensive approach and sharing best practices. I think that this makes a lot of sense, and I do appreciate this contribution.
Okay.
Point of order.
Mr. Chair, do you want this motion today to be considered by this committee so that this committee recommends that to council, or do you want me to take it straight to council?
I feel that that's a decision that's up to you, Councillor.
Okay.
Should you wish that it would be stronger coming to council, that's fine as well. But I do take your point.
Thank you. That's all.
No problem. We have a second point of order from Councillor Fleury. Please go ahead.
Thank you, Mr. Chair, for giving me the intervention here. Councillor Deans, I'm supportive of what you're saying. Could you also include Ottawa Community Housing to the conversation?
Oh, absolutely. All the partners. Yeah.
Thank you.
Appreciate the contribution. Not quite sure if that constitutes a point of order, but I do appreciate that contribution. Thank you very much. And Councillor Deans, you still have a bit of time left if you want to go ahead.
No, I'm finished. Thank you.
Okay. Up next, continuing on with members of the committee, we have Councillor Kavanaugh. Please go ahead.
Thank you very much, Chair. And thanks for all the points that have been raised. And in terms of working together. And thank you to the paramedic team and to Manager Poirier for all the work that's being done. It's been a tough year. In terms of expanding and of the paramedics, I just have a question in terms of equity and diversity. Mr. Poirier?
Yes, Councillor, through the chair, I did not hear the question. If that could be
Mr. Chair, we didn't hear it either. Councillor Kavanaugh is having a problem with the microphone.
Okay, can you hear me now? Okay.
Yeah, I can.
Okay, I've had some internet issues on and off. Apology. I just wanted to say thank you again for your work. And I realized that the paramedic service is growing, and I wanted to ask questions about equity and diversity as you grow. So my question is, how is that being taken into consideration as the paramedics grow?
Through the chair, we have an individual within our service, a diversity and inclusion coordinator, and that individual has been instrumental in communicating with staff regarding issues on diversity and inclusion. And it's been an important addition to our service because I think it has truly sensitized our staff to how diverse our community is. The second piece is that our service continues to grow. And as we grow, we've noted that we've been able to recruit individuals of visible minorities, but also we've been able to balance the organization where we're seeing that our recruit classes now are often 50% or more female. So we continue to be sensitive to diversity and inclusion issues. Our diversity inclusion coordinator has been a valuable asset for the service. And we will continue to monitor that. We receive information from the corporate HR on where we're at, and our performance trend has been very positive on our male-female ratio, on our diversity, on our visible minorities, that I think we've actually done a pretty good job. Not saying that we couldn't do better, but overall there's a good collective sensitivity to issues in our community, and that we're sensitive to those issues.
I am aware that that this work has been going on since back in 2004 and 2005, led by Councillor Deans at that time. So this is certainly something that the Ottawa Paramedic Service has taken seriously over the course of the last 15 years or so. Please go ahead, Councillor.
Oh, that's fine. I appreciate it, and I just like to hear the reports because I think it's important that we keep working on it and treat it as a priority. Thank you.
Thank you.
Moving on to members of council, we have Councillor Brockington. Please go ahead for 5.
Thank you, Chair. Good morning to you and to colleagues as well. And Mr. Poirier, thank you. We normally just get stats and spend a few minutes on this, but it's important, particularly an annual report, to get into the numbers and understand what's going on, particularly in COVID, when a number of variables have been impacted. I'm very concerned about the slide that looked at the drop in calls in 2020. We understand why that's the case, but I think we need, as a council and committee, to better understand what the ramifications are when people don't acquire medical care. And I think what's going to come out of COVID, lots of things, of course, we're going to realize and be studied and need to invest more in, but the lack of mental health care that people have not received during COVID, physical care, their regular care, doctor's appointments, and even dental care. There are a number of reasons for that. People are afraid to go out. They don't think it's safe to go to an office, and yet these offices are probably cleaner than they've ever been. And the steps that they're taking to protect not just their staff, but patients is top notch. How can we as a city better encourage, better communicate, better inform the public the importance of receiving medical care and seeking medical care, whether it's mental health, physical care, dental care? I think this is a problem. And when our emergency numbers are down, when people are waiting to the last second to go to the ER, we're hearing this from our ERs, that people are showing up with severe cases that they normally would not have waited to come in for. Those are the alarm bells. So how can we do a better job encouraging the public to seek care?
through the chair, I do not have a magic bullet for your inquiry. I can concur with your initial assessment that people did delay going to or acquiring medical care. And paramedics saw that as a reflection that our call volume may have gone down, but our overall acuity went up during that period of time. And that was particularly noticeable at the front end of COVID last spring. And paramedics were actually dismayed by the fact of how sick people were. And that translated into the emergency department. I think paramedics generally are advocates that we seek medical care as necessary. And we've been kind of quiet on the issue of please make use of 911 only when it's appropriate. We haven't been advocating continue to assess whether you need or you should go somewhere else. That's been quiet, and I think partly because of not exacerbating what is a problem today where people are waiting too long to get medical care. So it is an important issue in our community. And I think you also highlight the longer term ramifications, particularly on the issue of mental health, where there's a snowball that we haven't yet seen how large it is and how it's probably had this I don't want to overstate it maybe, but a monumental impact on our community as a whole, because people haven't been able to access all of the mental health support systems. And it isn't just the medical care, it's the ability to be outside, to do what we do, to socialize, to do all the things that are part of the human condition. So thank you, Chair and Councillor, for the inquiry.
Thank you. I just say whatever we can do through our social networks, e-newsletters, to encourage our residents to seek care when needed, and to underscore the fact that doctor offices, hospitals are clean, they're safe, PPP is being used, every attempt to protect patients is being taken, and people need to seek care when needed. So thank you, Chair, for the opportunity.
Thank you very much, Councillor Brockington. Do we have any further speakers on this report? Okay, seeing none, is this report carried?
Mr. Chair, Mr. Chair.
Yes, please go ahead, Councillor Deans.
I just wanted to point out that I am working on a motion that I would like to put before the end of the meeting. So, I mean, we can carry this, but if you can come back to it for that motion before we adjourn, I would appreciate that.
Absolutely, I would be pleased to have the city consider this motion at the end of the meeting. No problem whatsoever.
Thank you.
No problem. Oh, Councillor Menard, please.
Thanks so much, Chair. And I wasn't going to chime in, just listening in the background here, but I do want to. I'm not sure if there's somebody here that can speak to it or not, but City Council has passed a motion, which was unanimously supported. Around the issue of mental health and around the issue of a strategy. And my understanding from my discussions with Chief Slowly and the Deputy Chief is that is unrolling now. There has been already involvement with Ottawa Public Health and Public Safety. And that is coming to consultations that'll be going on with the community around a mental health strategy writ large for the City of Ottawa, and coming back to council and the police board. So I don't know if we can get some clarity on where that process is, so that we're not duplicating those efforts, of course. But that certainly was a significant endorsement by City Council previously, and I know work has been ongoing on that in the background.
Understood. Understood.
Maybe
can we have
I could offer a little clarity on that. I mean, yes, there is work going on for sure, but it is siloed. And I think what we heard today in this presentation is the silos are continuing and they're breaking out. And I think that we need to give a stronger direction that the lead has to be through under the umbrella of community safety and well-being, and it has to bring all of the partners to one table, not developing individual strategies. And I think that point needs to be reiterated at this point.
I consider this to be separate from that motion personally. However, I will ask legal to weigh in if they consider, I realize that we don't have wording in this motion yet, but based on the discussion that we've had here today, if they would consider this to be reconsideration, please, I'll turn it over.
And I don't actually, I'm sorry, Chair, I appreciate that. I'm not insinuating that there should be reconsideration or something like that. I just want better clarity, I guess, from staff around what is currently happening in the background. Because I agree with Councillor Deans, there needs to be more discussion amongst these silos so that it is a whole strategy that we're bringing in the community as well. That's been a huge concern. So I agree with Councillor Deans and the motion that she wants to bring forward, but I also just want to be sure that we're getting the information we can from what is also currently happening and has happened to date, because we haven't had an update on that yet. Just to clarify, Chair, on that point.
Understood. I still would like legal to weigh in based on this discussion to provide some clarity on whether they would consider this to be reconsideration. Please go ahead.
Mr. Chair, I would need to look at the original motion to be able to determine that, and I'm wondering if actually the clerks might better be suited to answer the question.
Okay, so on that point then, we will hold this item and not carry it right now until the end of the meeting so that it can be included within this report. We'll let it sit for a moment. I do see Vice Chair Eglai would like to say a few words. Please go ahead, Vice Chair.
Yeah, I guess what troubles me about this is not whether it's reconsideration, and that's obviously something the clerks can advise us on, but I think it may be moving too quickly. We don't have Mr. DeMonte here. We don't have Dr. Etches here. We don't have Chief Slowly here. We have none of the leads for the partners that are supposed to work together, as Councillor Menard pointed out, to tell us where they actually are. What steps they've taken and what we can see coming in the near and not so near future. So it seems to me, and again, I haven't seen the wording of the motion, but it seems to me that this might be something, the question was posed to you at the beginning, Mr. Chair, whether you thought it was appropriate to bring it at committee or whether to bring it at council. I think it may be more appropriate to bring it at council, where those people could be and would be available to answer questions of substance around whether it's necessary to bring this motion or whether this motion needs to be amended in some way in terms of its wording. So not to say don't deal with it, but let's not deal with it in a vacuum. Let's deal with it with all the right people around the table to answer the questions. And then we'll know how this motion should look, what it should say and what it should do, rather than voting on something, as I say, effectively in a vacuum without any of that input in from the community and city stakeholders that could, as Councilor Menard said, could inform us as to where they are right now and where they're going. So again, I haven't seen the motion, but it would seem to me when it comes up, we might want to discuss whether it is appropriate to be dealt with at committee or whether it should be put over to council where we can actually be informed before we make a vote on something as important as this.
I think it would be quite becoming of this committee to have made this recommendation to council, in my opinion. But I do take your point and appreciate it. This is something that will be appended to should it be successful today, appended to this report, and will be considered later at council, where we're able to ask further questions on this. I don't know, Councillor Deans, as you are the mover of the motion, I will give you an opportunity to respond to that if you'd like.
Yeah, thank you, Mr. Chair. My thought's exactly your thought. If we introduce it today, then all of those players will have the opportunity to take it away and consider it before council, and then they can offer advice on it at council, having had the benefit of seeing it. So I think with that in mind, it makes sense to put it on the table today.
Councillor Meehan, please.
Thank you, Mr. Chair. This is a follow, I think, to some of the discussion that Councillor Deans had with Mr. Poirier earlier. The Ottawa Police Service is in the process of looking for partners or service partners for its new South facility. I'm sure everyone is aware that we have put on the we are delaying the south facility right now in order to mitigate some of the escalated costs due to construction. And we are looking for service partners. And I'm just wondering if I could maybe, as a direction to Mr. Poirier, to explore the potential of maybe partnering with the OPS. I know it's not in the west end of the city, but it is in the south, in a great location, maybe as a satellite office for the paramedic service at this point. It could be a great partnership in the south end of the city. So I would just like to make that as I'm not sure how to do this, but maybe to explore with the OPS, with Chief Slowly, the potential of some sort of partnership in that location, because we see this facility as being quite a comprehensive and multimodal facility, and we are looking for a good partner. And certainly the paramedics, I think, would be an awesome partner to have. So I would just leave that with you at this point. Okay.
Wonderful. Please, yeah, go ahead, Chief, if you want to respond to that. I think this is probably a discussion that you'll want to take offline with the councillor, but please go ahead.
Yeah, I will do that.
Yeah, thank you, Chair. Yes, we will investigate that. I am aware of the South facility, and I will speak with the Ottawa Police Service with regard to the opportunity that may be there for us to partner. And
that'd be wonderful. Yes. That's all I ask. Thank you so much, Chief. Thanks.
I'll end by saying that I recognize that we are asking people outside of our jurisdiction to work together. But I think that it is incumbent on this committee to take a leadership role when it comes to the mental health of our employees. So I do think that it is appropriate, considering that within this report, there is a section on a mental health strategy for the paramedic service. Expanding that mental health strategy to include other groups so that we are working off the same song sheet, I think is a good recommendation to make to council, and something that should be debated there after, should it pass today. So I will hold the passing of this item until the end of the meeting, until we have that motion prepared, and we will deal with it then. Moving on to item number 2. We have the administrative updates to existing parks and facilities bylaw. The recommendation in front of us today is, 1, that we approve the administration amendments to the parks and facilities bylaw number 2014-276 as described in this report and detailed in document number 1, and 2, to authorize the general manager, recreation, culture, and facility services to finalize and make administrative adjustments to the amending bylaw. If you do have questions on this, it is a bit of a housekeeping item, I understand that. We do have Mr. Chenier available to answer any questions. There has been no correspondence submitted to the clerk's office to date, and we do not have any delegations on this items. So does the committee have any questions for staff? Seeing none, is this report carried?
Carried.
Carried. Moving on to item number 3, where we do have quite a few public delegations.
Mr. Chair, just on a point of order.
Yes, please.
I have a
yes,
draft,
please go ahead.
I have a draft motion now. I'm wondering if I could just introduce it while it's fresh in my mind, and then I'll send it to the clerk. It's just in a draft form, but I could read it and then send it to the clerk.
I think that's entirely appropriate. We should allow the committee to consider it while we look at this other item before coming back to it. So yes, please go ahead.
Thank you. So the motion would read that the Community and Protective Services Committee recommend that City Council direct the General Manager of Emergency and Protective Services to, as soon as possible, take the lead to develop a community mental health strategy, working with the Ottawa Police Service, Ottawa Public Health, relevant city partners, and community stakeholders, including Ottawa Community Housing, to ensure that the efforts that are being undertaken already are coordinated and not duplicated, and report back with a draft strategy and any related funding in advance of the draft 2022 budget.
Okay, please ensure that the clerk's office receives this motion, and we'll let the committee ruminate on this as we go through the next item, and we'll bring item number 1 back.
Mr. Chair, could we all get copies of the motion as well?
Yeah.
Oh, yes, of course. Thank you very much. So item number 3, as I mentioned, we do have 10 community members that have come to weigh in on this item today, and we do have a presentation from Dan Chenier and Kevin Wary. So what we're considering here is that one, we receive for information the preliminary draft Parks and Recreations master plan as described in this report and attached as document 1, and that 2, staff direct staff to bring forward a report tabling the final Parks and Recreation Facilities master plan in consultation with committee chairs to Planning Committee, Community and Protective Services Committee, and Council prior to the approval of the new official plan. It is important to note that this is not the asset management plan, that this is a larger guiding document and one that at this point in time is in its preliminary stages. So I would ask respectfully that community members and committee members please ensure that their comments and questions are germane to the topic at hand. I will now turn the floor over to Dan and Kevin to make their presentation. So please go ahead.
Monsieur le Président, members of the committee, merci de nous accueillir aujourd'hui pour parler de notre plan provisoire. Thank you, members, for giving us the opportunity to talk about our very preliminary plan on Parks and Recreation Master Plan. As the chair has emphasized, the plan that we have before you today it builds on several months of consultation with community stakeholders, but primarily in a vacuum of providing them with what the straw dog of a master plan like this looks like. And so though we've been collecting some very good feedback in terms of people's priorities and ideas and those kinds of things, those that we've talked to have not had an opportunity to have a look at essentially the straw dog of what we will be feeding into the official plan as a supporting document and into our responsibility for meeting provincial regulations in terms of park planning. And so the document that you have before you still is in draft form in several senses. And one very important sense that I want to emphasize is that the Parks and Facilities Master Plan builds on a service level provision ratio per capita. So you will see throughout this plan, 1 to 20,000 or 1 to 30,000 for various kinds of recreation assets. Of important note, we don't yet have the population projections to 2031 that will be used in the official plan. So because of that, this plan uses available data from ECOS research to do two things, to identify the level of provision that exists, as well as to make recommendations in terms of heading towards 2031. Both those aspects of the plan need to be revised using what will become the official plan population provisions, as well as the recommendations that fall out of those, because if the numbers vary significantly from what we are looking at now, then we will have to go back and recalculate and then provide new recommendations. We hope within the next couple of weeks to have the data on official plan so that we can do that work and incorporate it into what will be the next important stage of this, which is consultation with the groups. So essentially we are following the same roadmap that the official plan did of submitting a document that people can look at and understand what we're driving towards as a final plan. But this is by no means a product that is ready for final recommendation to council. I'll now turn it over to Kevin Weary, our manager of Parks and Recreation Facilities Planning, so that he can take you through the presentation. Over to you, Kevin.
I think you're on mute, Kevin. I can't hear you.
Thanks, Dan. Sorry about that. Thank you, Councillor El-Shantiri. Could I please get the presentation on the screen? Excellent, thank you. So as Chair Luloff mentioned in his opening remarks, this is the Parks and Recreation Facilities Master Plan. It is our preliminary draft, and this is the most comprehensive master plan that we've undertaken for both parks and recreation facilities at the same time since amalgamation. Next slide, please. Thank you. So there's a lot of things driving this master plan, but the first ones that I must bring up, of course, is that provincial legislation as of September of last year placed some requirements on us that must be fulfilled prior to September of 2022. Firstly, we need a municipal parks plan, which is in support of the official plan, and this was due to changes under Section 42 of the Planning Act. This park plan is a requirement in order for us to proceed with official plan as well, and which is why one of the reasons why you will hear us say that we need to have this approved in advance of official plan, because this is actually locked in as a document with official plan. And then also the September COVID-19 Economic Recovery Act required the city to update its development charges bylaw. Recreation facilities and new park development, some parts of new park development are within the development charges bylaw, as are many other services within the city. The work we are doing now can be considered as background study as to what is the city's service level when we are determining how many new facilities we need due to growth. Next slide, please. So there's been a lot of confusion about what this master plan is, so we're just offering some clarity today. What this master plan does do, it is a review of current service levels for municipal active parkland and recreation facilities by type. That is, what facilities we have by transect, and we're talking indoor and outdoor facilities. So, a pool is an indoor facility and a baseball diamond, for instance, is an outdoor facility. And what is our provision level snapshot right now per 1,000 residents? And this includes how much parkland per 1,000 residents as well. In this plan, we will be making recommendations on the per capita provision level targets for Ottawa. And we have been working in the background, and this plan, as you see as the attached document 1, identifies gaps between the current inventory and provision level targets. And we are looking to meet expanded population growth to 2031. Note there's an asterisk there, and this goes back to Dan's comment. We are yet to receive, and we have been promised and reassured that we will receive by the end of the month, the population projections per OP. So what we have used is we subscribe to Environics Analytics, and Environics has provided us what their assumed growth is. However, they are not as informed as the official plan team are, because it's official plan that is directing growth, whether it's in Greenfield or inside the city. We are making recommendations about the amount of new parkland and the number of new facilities to be developed. That is in the plan. This is, of course, again, based on the data we have set. And this also provides us an opportunity for creating a strategic focus for equity-seeking areas by transect. And by saying that is that we're identifying gaps, and we're identifying gaps in whether it be equity neighborhoods or areas of interest, and by doing this, we are able to perhaps assign priorities, because as investments become available, we may be able to invest based on strategic priorities as well. Next slide, please. Throughout our consultation, we've realized that there's a lot of things that come up that we need to identify as things that this plan does not include. This is primarily a growth document. As the city goes forward with the new OP, what do we need to look at expanding upon? So what this plan does not do is look at specific recommendations or improvements and additions for existing parks and recreation buildings, in the sense that existing buildings might have certain needs. We would be looking at only perhaps in the future expansion or growth of new buildings. We're not reviewing programming fees or facility allocations. That's an operational matter. This is a built form approach. And lastly, this is parks and recreation. I know our department title includes the word culture, but this plan does not include museum, theater, or cultural facilities. This is partially also related to development charges, where development charges only allow us to make charges for parks, for park development and for recreation facility development. Cultural facilities have to fall under a different funding strategy. Next slide, please. So here's our project timelines. We've been working very fast since we were initially learned of our new direction late last year. I believe most of committee and council is aware that we launched our project in January with public consultations, which included 2 different surveys. The surveys had to do with recreation facilities versus outdoor parks and facilities. And then in the background, staff were working on benchmarking and identifying how our facilities are used and the pressures that are upon them. We looked at trends, and when I want to mention trends, I think most councillors would recognize one of the most recent trends that's in an upswing is, for instance, pickleball. And then we also did our initial analysis of all the round 1 feedback that we received. We conducted some 6 extensive virtual public meetings, and within those meetings, we received information from an extremely wide cross-section of the city, and we took that information and massaged what we had been learning from benchmarking, for instance, against other municipalities. Here we are today with our preliminary draft master plan that's going for committee and council to receive. Because from this point forward, we are now going to take this preliminary plan, and it is always easier for us. Our first consultations was, we ask questions like, do you use our facilities? What do you like about our facilities? What don't you like? What prevents you from using our facilities? So we took all those questions, and then we looked at it, took a snapshot as to where we are. And now we come back to the public and to stakeholders as well. And when I say stakeholders, that includes school boards, the NCC. We actually have meetings also with the development industry coming up as well. We are going to say, here's what we were able to understand of our snapshot in time, and from all the information we were provided already, here's the draft plan that we have come up with. Let's please look at it from, does it meet what was asked? Is it seem reasonable? Is it something that you would support going forward? And is there anything missing? Please let us know. And then in September, we will be bringing forward our final draft of the plan for committee and council consideration. It needs to be ahead of the official plan in the sense that it is a supporting document to the official plan, but once official plan is approved, it would be actually an OPA for us to add this afterwards. So this is why we are proceeding on advice from legal to have it approved in advance of official plan. Next slide, please. So that's just this is our preliminary overview. As I said, we're here for, really it's an information item for committee. My contact is there, but I'd also like to thank Selma Hassan and Deanna Schofield. They're both identified here. They really are the project leads and have been pedal to the floor on this, working very hard to get us to this point where we are at today. Thanks, committee. Thank you, Chair.
Thank you very much. We have public delegations to go to before moving on to questions to staff. Up first, we have Paul Howard. I believe he's speaking as an individual. Paul, please go ahead for 5 minutes.
Okay, thank you, everybody, and thank you, Chair. I'm really learning a lot here today, and I appreciate all your hard work. I'm give you a little bit of background, just in terms of myself. I'm a tech guy, frankly, and in terms of helping youth, that's always been my focus. My ask today is about a wider commitment to inner city, and definitely want to flag that for the committee. In terms of my commitment to youth, it's a fierce commitment at some points, but I will tell you that this commitment is offering hope to many youth with tangible achievements already, including last 4 months, we raised over $200,000 for food insecurity direct to families in South Ottawa. Also recognized by the NFL, and I actually fund 18 programs that are central government money, including St. Pat's football team, all new equipment, Strong Orange anti-violence program, something new's happening there, and a youth business incubator, and sit on the Ashton-Dixon Youth Empowerment Board. So enough about me. One of the things is, from my personal experience, I'm going to share with you, working with the Herongate donut hole of parks and services, I'll call it, is that the crime is mobile. Because this is the protection committee, superior protection committee crime. And we're seeing this with the shootings, 29 shootings. It's very mobile. But what I will tell you is that I've known every person that's deceased, okay, or the shooter, one of the two, or both, every single one of them. And I've met them as young kids. And believe it or not, most of them at one time have lived in Herongate, which is, still has 1,471 units. So these shootings are mobile. They affect every single ward, but a lot of them are germinating in Herongate. And when we ignore these communities with recreation, it impacts everybody. And so I have something I'd like to speak to, but I just want to give you some background. And just when I'm hearing about some of the talks about the police, and I'll tell you, Carl Cartwright is a good man and he's the right man. I know him. And I just want to leave you the story because I know my time is short, and then I have an ask for you to consider for your consideration. And I don't know if we call this parks nullification or not, but I witnessed a group 7 years ago on Sandalwood build their own sports field by hand. Brian, the biker, literally, he surveyed it. The folks got down on their hands and knees with shears and trowels, and they built their own sports field. Later on, I believe it was Kelly Tonner, put some posts there. But that's the type of thing that's been going on where the people don't even have their own proper sports field. So they have 1950s baseball fields. So I know there's a lot of considerations for money, but at the same time, I don't think we can forget in the master plan that there has to be a commitment to the inner city, because these youth know when they're treated as second-class citizens, and this only emancipates or grows out from these communities. And what I'd like you to do very simply, because I don't need my whole time here, is when you're developing this master plan, to think about these communities, to think about equity and equality, and that we have to do a better job. And I'm not saying there's probably many good reasons, but everything should be seen in the lens that recreation and youth empowerment is so important, offering hope, and we need to address these in any future plans, however you do it. So that's it. That's it for me. Thank you very much.
Thank you very much. I was incredibly impressed with the way that staff have put this together to ensure that each of these amenities are tied to the amount of population within an area. So I think that equality and that equity is certainly being striven for with this report. With questions to the delegation, we have Councillor Turney. Please go.
Great. Thank you very much. And thank you, Paul, for coming out today. I actually didn't have a question. I just wanted to thank Paul for all his hard work. I don't know where you find the energy. I sit on many of the same committees that you're on. And if I only had half your energy, I could achieve so much more. So anyway, I just want to thank you for the work that you've done.
Thank you very much, Councillor. I'll tell you, it's very personal because I'm born and raised in Herongate, and I went to Ridgemont. My kids go to St. Pat's. So this is very personal for me. When I saw the shootings 4 nights in a row, that's when I really got going 5 years ago.
Any further questions, Councillor Turney? Okay, great. Thank you very much for coming out, Mr. Howard. We appreciate your contribution. Up next, we have Leo Doyle from the Ottawa Shooting Stars basketball. You have 5 minutes. Please go ahead. Mr. Doyle, are you with us? Mr. Coordinator, do we have Mr. Doyle in the waiting room? Oh, there you are. Go ahead, please.
So for next slide, please. So my name is Leo Doyle, and I'm a volunteer board member with the Ottawa Shooting Stars Basketball Club. My purpose for being involved, I've been corresponding with Dan Chenier since about 2015 when the city started consultations on rinks and fields at that time. My point was that there's a severe lack of gymnasiums in the city of Ottawa that are accessible or suitable infrastructure. In particular, our not-for-profit largely operates within the inner ring of the city. So the old neighborhoods, Alta Vista, Old Ottawa South, Glebe, Westboro, Vanier, etc. So where we're operating, there really is not much by way of recreational infrastructure. It's all rather old, but we do, mostly through community use of schools, some private facilities, other things that we can cobble together. We've been providing recreational opportunities to about 700 youth. We host leagues, but lately, we're using the sport of basketball as a platform for lifestyle development. But it is really the lack of predictable, suitable gym space that blocks our ability to meet what really is a tremendously growing demand. Next slide, please. Really, we're doing a lot of social impact these days. We're mostly focused on how do we use the sport to develop children and youth, in particular disadvantaged youth. Next slide, please. We're involved with Indigenous populations. We ran an event, Hoops for Reconciliation. Next slide, please. Next slide, please. And Hoops for Reconciliation basically brought together inner city kids, urban Aboriginal kids, the whole gamut of Ottawa around the sport of basketball. We were able to run this at Carleton University, mostly because I donate a lot of money to Carleton University. And I find that, if you donate some money, you get a little influence and they'll make the gym available for you. Not everybody has that advantage. That's why we need the city to be playing its role in providing more gym space. Next slide, please. We use the sport to connect with youth, to teach them how to be leaders, how to run events, how to do things, take ownership, take agency, but we need space to do it. Next slide, please. Engage with the Rwandan community. Again, engagement. Next slide, please. The two young men on the ends here have both been recruited now by the Ottawa Police Department through programs that we overwhelmingly sponsored. I wrote letters of reference for both of them. They learned de-escalation, how to manage conflict, how to learn soft skills by becoming basketball officials. We need to take advantage of these opportunities, but we need space to do it. Next slide, please. So basically, we do all of this with next to no support from the City of Ottawa because we really don't provide gym space. We don't get a fair deal in terms of what the city does for other sports, such as soccer, hockey in particular. We don't get any of that, but we need some of that. Because we're really just sort of burning ourselves out. Next slide, please. If we had 10% of the support that hockey got, we would be doing well. Next slide, please. So the plan really doesn't address any of this. The plan says, the future of a sport like basketball is basically, it says, go play at an outdoor court or a community.
1 minute.
These are not solutions. This basically, community use is not a solution, and that's what the draft report says, and we've got to address that. Next slide, please. Basically, it fails the OP guide 15-minute, it fails on gender equity, it fails on equity and inclusion. Next slide, please. And so for these reasons, basketball, this is an event going on tonight, being Black in the world of basketball in Canada. Basketball for a wide range of communities is a platform of how you develop your life and your skills. Why is the City of Ottawa in this draft report, which is saying this is not our problem, this is the school board's problem, why are we not addressing this? When I spoke to a school board official, he said they were disappointed with the position that the draft report had taken. I can't speak for them, but you'll have that opportunity.
Thank you very much. That's your time. I would like to give staff, Mr. Wary, I'd like to give you, before moving on to questions, please, I'd like to give you an opportunity, please, to respond to that. Thank you.
Thank you, Mr. Chair. First of all, as was demonstrated in the slides, when it comes to allocation of time at facilities, that's not the goal of this report. But regarding growth of the city and pressures on existing facilities that we have, I would further point out that we're actually in process of working through with the French Catholic School Board to construct a new gymnasium and community center in Old Ottawa East, which is in the urban area. very much interurban. Secondly, when it comes to gymnasiums, we primarily provide a gymnasium as part of another facility. We don't have standalone gymnasiums. We provide gymnasiums as part of, for instance, a community center or a recreation complex. And as part of growth related items, you know, if we have existing city facilities in the core that growth demands expansion upon, the addition of a gymnasium is how we would deal with it from a growth perspective as well. There are a number of programmatic items that the speaker spoke to that I'm not well equipped to respond to. But generally speaking, we are preparing perhaps to look at gymnasiums as an item other than a gymnasium as included as a community center or as included as a recreation complex, for instance.
Thank you. So understanding that this sorry, Selma, please go ahead if you'd like to follow up on that very briefly, please, as this is quite a lengthy.
Thank you, Chair. I just want to emphasize one thing that Kevin just said. In the next version of the draft, we do plan to pull out gyms as a specific item in Appendix A, just the way that pools and arenas are pulled out. So we should be able to provide more detail on provision levels across the city for gyms. Thank you.
Understanding that this report is not about allocation, please go ahead with your questions, Councillor Leeper.
Thanks, Chair. And Leo, I would just ask in terms of what are you proposing as solutions to this? We're talking about facilities. Is it more facilities that are needed?
Yes. As a recreation master plan, well, first of all, you need to remove from the report the recommendation that basically gym sports, your only resort is community use of schools. That's what it says. And that is a non-solution. For a sport like basketball in particular, they put forward, well, you know, the city has outdoor basketball courts. We have about 250. That's not a solution. If you have a look around during COVID, many of the streets have been adorned with basketball hoops because it's an easy way to get access to recreation. I mean, it's good that the city provides outdoor courts, but a lot of people can provide that solution themselves, as we see. What we need the city to do is to do at least two things. One, be a better supplier of these facilities. Use all of the tools that you have to address this big gap and shortage that your own report talks about in terms of this is what we heard from people. We would like more of this. When it comes to things like in the report, when it comes to things like swimming pools, the city says, well, we're not going to build outdoor pools anymore because indoor ones are more useful. Well, why would the same not apply to an indoor sport like basketball, where the city doesn't address it at all? So that's one of the things I'm asking for, is you've got to use the tools that you have to work with all of the partners. Clearly, we cannot ask the city to take on a massive new responsibility that historically has been met by community use of schools. That will still likely be one of the main ways, but the city has got to use the tools and capacity that it has to help out, to address the demand and the growth. Secondly, the city needs some policy to be more supportive to organizations that need courts. We have a policy on outdoor rinks. We provide funding to people to help run outdoor rinks. We could use some of that help to even just deal with the school boards. It is not a psychologically safe relationship.
Respectfully, Mr. Doyle, this is outside of the scope of this discussion. So if you can keep your comments, please germane to the report.
Well, I'm talking about what explicitly what the report said, which was, so I'm saying that the city has got to amend that part of the report and take ownership in terms of saying we're going to play a role in the provision of gymnasium facilities. And secondly, we're going to look at what we can do in terms of policy to be more supportive to these organizations that are supporting many youth.
Great. Thanks, Leo. Good to see you, and I hope you're well.
I am. Thanks.
Thank you very much. So in order of committee members before members of council, Councillor Fleury, please.
Thank you, Mr. Chair. Leo, thank you for your presentation. You work with inner youth for basketball. It's well captured, well understood. Could you maybe explain why you have concerns relating to simply going the numbers routes, the allocation routes? Because when you first saw the report, you came to me and asked about existing conditions in our centers which don't meet the standards, and I was interested by that fact, and I don't think your presentation highlighted the current barriers of accessing the existing urban facilities.
That's a very good point. If you want to understand where the most disadvantaged people live in the city of Ottawa, then do a survey of the recreational facilities. And the outer rings have both the best school facilities and the best city facilities. Something like the Richcraft Center, Minto, Barhaven Minto, the Dubuis Center. They're big and modern. What the report fails to do is to really, which the city's 2019 audit, makes mention of, that there is a range of what the city has. So what the city has in Lower Town, in terms of Le Patro or Routier, are old facilities that really need to be redeveloped, and the report doesn't speak to that. So there's a lack of equity. There are no standard size gymnasiums within the urban core of city that the city owns. Even the gyms that the city built at Saint Laurent and Overbrook are substandard sizes. So there is a profound lack of equity in terms of what you get. When we build sensplexes, and we overwhelmingly fund them and enable them, we build them to tremendous standards. Even if you just look at the outdoor rinks that the city provides through what once was the Sens Foundation, it's astounding, the difference in terms of quality and quality. So that sends a message to kids when the outdoor rink has modern NHL boards and markings, and the basketball court is just basically a very low grade steel pole with a hoop on it. It's not adjustable for younger children in terms of making it accessible. So I think the city has a lot of capacity to look at that differentiation of where is the need and the caliber of the facility that needs to be provided to meet that need.
Thank you for being clear. Appreciate it.
Councillor Menard, please.
Thanks very much, Chair. Nice to see you, Leo. Thanks for being here. And I wanted to raise a couple of examples, if I could, to try to illustrate what may or may not be possible as part of this plan. As you'll likely know, the Deschâtelet building in Old Ottawa East, looking to have a community center there, and beside it is supposed to be built a gym facility. Now, there's a school that's in the Deschâtelet building coming, of course, but that gym facility is supposed to be a shared facility. I'm wondering if in the current policies we're putting forward, is that possible? Is that still part of what the plan would be? And then I wanted to talk to you about Brewer as well. Brewer Park is a citywide park. It's not seen as just a local park. Many people go there across the city, and eventually that will need a full renewal. And the idea would be, can we put a gymnasium facility, for example, at Brewer for broad use within the core and across the city? So under the policies that you're seeing, are both of those examples still possible? Are they not? And what would you like to see instead?
Clearly, we would welcome more gymnasium facilities, but in both instances, I've been told that, well, allocation isn't part of the discussion, but who gets what is incredibly important. So my experience is when I remember when the Richcraft Center opened and we got in touch with them shortly after, we were told that soccer had rented, any additional hours that might be available. So in terms of the programming of those spaces, there needs to be, I think, more communication. The city I attended the consultation on standards, and the city proudly points out that 90% of prime time in city provided rinks goes to minor sports. Why do gym sports not get that same deal? I know that we have to, oftentimes we're told that, well, it's for community use. I've lived in Ottawa for 32 years. Like I kind of feel like I'm part of the community. And yet oftentimes the language that is used is, well, you're something else. So again, great to have the facilities, but even here, like we say, well, we'll provide a gym, but in the new standards, when we talk about ice rinks, it's like you're always going to get two. So maybe, since they're relatively cheap to provide, why not do more? But I do think that Brewer is a tremendous opportunity because it's on the LRT and low-income kids can access it. And the Châtelet is excellent as well because LRT is very close by, very, very low-income populations, but that will make no difference if we don't have policies to help organizations that serve those communities access it. Similarly, engaging with Immaculata High School, and we're trying to get a discussion. That is why the discussion on community use of school, if you understood how complicated and difficult it is to work with the school boards, given that the risks and other things that they are trying to manage, it's very difficult to get space. We got kicked out of Immaculata when they started an elite prep school program. We got kicked out of Notre Dame High School for the most part when they started an elite prep school program. We got moved out of St. Pius because they started an elite prep school program. So the children that we're providing who really, they just want to be included, it's very, very difficult if organizations like the city say, well, this is, go to community use of school, because the community use of school people don't really see it as their problem to solve. So where do we go?
Okay, as a former school board trustee, and I know Councillor Kavanaugh as well in that role, I know we've seen examples of that as well, and it can be a difficult proposition. So I appreciate those comments. Thank you for raising them.
Thank you very much, Councillor Bernard. Up next, we have Sandra Milton from the Lower Town Community Association. You have 5 minutes, and please go ahead and welcome to the committee.
Thank you very much. Good morning, Council. My name is Sandra Milton. I'm an engaged Lower Town resident, leader and Friends of Lower Town Parks Coalition and Lower Town Community Association, and member of the Pickleball Coalition. Thank you for the opportunity to comment on the drafts master plan. And I'm asking specific to the neighbourhood of Ottawa Core. This includes the Byward Market, Lower Town, East and West. I'd like to provide points for consideration as inclusions to the master plan based upon the downtown core being a fast-growing community with aging facilities and no new facilities planned. When reviewing the plan, there is no specific comparison identifying older facilities to new ones in the outskirts of Ottawa, addressing our expansion and growth in the core. The demographics of the community are mixed and include low income, diverse communities, students, long-time residents. These include Ottawa community housing, homeowners, apartment dwellers, shelters, etc. In our area, we have 2 community centres. These include the Routier, an English centre, and the Patro, a French centre, which was built in the 80s. This includes the Champagne Pool, which built in the 20s, and I'll include the Plant Pool, which was built in 2001. When they were built, there were no apartments, towers on Rideau Street. The community was much smaller, but since the community has grown and continues to grow. So on page 70 to 71 of the plan, we talk about the rec centres, etc. But our facilities are older and they're not captured as equal as the newer ones, and they should not be. They're very different with different standards and spaces. Our centres do not have the same value as a centre built, say, 5 years ago. Ours are 20 or more years old. The standards of the facilities all require upgrades, renovations, additions to deal with the existing use and support the local and future economy in the area. The program is different and not able to offer the same level as other facilities due to its age or requiring updates. The Patro equates to a complex in another part of the city. We can only book swimming at the Patro. There are no other city facilities bookings at that center. The Lower Town facilities are not the same facilities as outskirts of the Greenbelt, and no standard size gyms for sports. The Champagne pool cannot be compared to a sportsplex. These older facilities with least green space, while seeing tremendous growth, needs focused facilities investments, like the Routier, Champagne pool, and Patro. The residents need these and other new facilities to be built in Lower Town. We like facilities for low income, children who cannot afford to join clubs or whose parents do not have a car, and seniors walking to their local community center. We like gym space, basketball space. The Pickleball Coalition want to work with basketball to help share that recreational space. We have needs for better programming for the children and our seniors. We need equity for all in Lower Town to ensure the needs are met and may be different than those in other areas of the city. I ask for your consideration. As the urban core Lower Town continues with the population growth, we request the need to be included for new facilities and upgrades to existing ones. The draft plan does not reflect growth. The current plan has addressed growth in new suburbs, and some of them are successful, Minto, Francois, Dupuis, Richcraft. We need focused facilities and reinvestment. We ask that you consider our aging facilities, lack of recreation and gym space, that no new planned facilities or upgrades to the existing in the downtown core is addressed. We want you to ensure the neighborhood equity index in your analysis are for the pools, gymnasiums, arenas, allowing for more multi-sport play, that it is reviewed for the well-being and needs in our community. And we ask for your assurance that the added pressures that intensification is bringing will give us more available space, facility spaces for community use. So thank you very much, and we appreciate your consideration.
Thank you very much. Can I ask Mr. Wary briefly just to respond to aging facilities? Isn't this something that will be looked at not within this report, but within the asset management plan?
Yes, Mr. Chair, you are correct. So when it comes to aging facilities, there is forthcoming by 2024 a recreation asset management plan, and this is also one of another provincial mandate that has been put on the city is the condition of the city's assets. In 2019, Council approved the recreation infrastructure standards, and within those standards, it does speak to things such as when a facility comes up for redevelopment, it is to be built to a certain minimum standard. Best example I have is we have some swimming pools, for instance, that are either 20 yards or 25 yards. Our minimum standard is 25 meters because I think it was the 70s when we changed Canadian standards from yards, from imperial to metric. As facilities are redeveloped, there is already a standard that they must be redeveloped to, and that comes under the Recreation Asset Management Plan, which is coming forward to Council in the next term.
Understood. I know that I've got a couple other swimmers on the committee in Councillor Fleury and certainly in Councillor Kavanaugh, and I don't think we mind doing a couple extra laps if it's an older facility and measured in yards. Any questions? We have got Councillor Fleury. Please go ahead.
Mr. Chair, I appreciate that you give staff the opportunity to answer. I would have a follow-up to Kevin, and I do have a question for Sandra. I want to make sure I'm following committee procedures, so can you advise me?
Because I did give the opportunity for staff to respond, you may go ahead with your question.
Okay. So Kevin, you gave a good example there. I've met with you. I've met with asset management. there seems to be a bit of a disconnect. Asset management will repair the roof, will make sure there's filters, will upgrade to within the walls. But say Champagne's an example. There's others. We could use gyms or so on. So I don't want you to hold me to that example, please. But our pool standard is 6 meters, 25 lanes. We can never expect Champagne to turn into that model. And the community gets that, but there are missing amenities. So can you clarify, what are we supposed to expect out of asset management other than repairs and upkeep?
My apologies, on mute. And I see Jen Nielsen's face has popped on. So when it comes to expectations from asset management, I would like to defer to Jen Nielsen. She is right now the manager of, oh my gosh, I'm sorry, Jen.
Manager of asset management.
Oh, that's why it was too simple for me to say it. Anyway, so Councillor Fleury and Chair Luloff, if it's okay, I'll defer the response to the manager of asset management.
Yes, please go ahead.
Chair. So we're working very closely with Kevin and his team. So it's a bit of an iterative process. So through this master plan update that Kevin is doing, he's starting to identify the levels of service that we currently offer. When we get into the asset management plan, we'll look to see how we can apply those citywide, and it doesn't happen overnight. As you can imagine, as time has gone on in different areas of the city has developed, and also recognizing there was 11 different municipalities before, there's different levels of service across the city. So as Kevin mentioned, we'll be bringing that forward through the asset management plans. And I hear what you're saying in terms of growth and renewal and how that fits together, and how we look at basically rebuilding when a facility kind of reaches end of life, or what we put back there. And that's an area that we still need to work on, but we are working closely together and making sure that those two pieces fit.
I know you're working on it, and I appreciate the clarity, but just again, I don't want to hold you to this example, but if we use Champagne as the example here, just because to stay consistent, we have an older facility, the oldest pool in the city. It's not the standard. It's not 6 lanes, 25 meters. I understand that. Kevin seems to say, when asset management touches that facility, at some point it'll be upgraded to that standard. Is that fair to say, or is that there needs to be a continued conversation between your teams? Because I'm not hearing a clear answer that asset management will take that on and bring it to standard.
So I think we need to look at the affordability and financial sustainability of how far we go. So yes, the standards are there, but we need to look at what the list is of all of the different needs across the city, and to what extent we can bring them up to new standards. So if it means like demolishing the whole building so we can start from scratch and build a pool that's big enough, that's a very different thing than making accessibility modifications, for example, within the current envelope. It's a very different scale of renewal, if you will. Does that make sense? Or
because we're getting a little bit deeper into asset management, which is another report that'll be coming later, I would just respectfully ask if, I see Dan Chenier would like to weigh on this, please go ahead. But if further questions could be germane to the report, I'd
apologies.
Not to prolong the discussion, and Champagne is a much like the Aberdeen Pavilion, discussions with councillors have been held in the past as to whether it should be replaced, but it is a heritage building, and the Friends of Champagne, much like the Friends of Plant, showed up, and preserving a recreation experience within a heritage building is the other consideration. That aside, as a broader discussion, you will recall that last December, as part of the facility management audit, the auditor flagged the need for staff through 34 recommendations in the audit, flagged for staff the need to go and have a look at, when do you make the decision that enough is enough and you need to replace rather than repair? And so that process, and within this year and possibly going into next year, we are working with Jen and the asset management team and other departments about what do we put in place to satisfy what the auditor identified, which is right now we don't have a solid council sanctioned approach to the you know, when is it really end of life and you need to budget for a replacement as opposed to you know, a retrofit or even an expansion. So that is work that's going on outside of the facility plan, and will possibly even be a pre-delivery even before the recreation asset management plan, because the audit recommendations are driving that. So that is another piece, just to assure you that it isn't a piece of work that isn't being done. AGUs pointed out that piece of work that needs to be done, and we are actively pursuing that right now.
So recognizing that I've been quite lenient on this point, I'm just hoping that the councillor can continue on a line of questioning with our.
Mr. Chair, just a heads up, I will be, when questions to staff, I will be coming back to this point, because I do think it's the nuts and bolts of this report, or the challenges with some of the elements of the report. But for Sandra, you've been in the neighborhood for a number of years. It's statistically the lowest income neighborhood in the city. What can you say for the families that you're talking to? You're an engaged member in our parks. You see the families in Lower Town. I think that's a compelling side, that there's been, the facilities have been there since the 60s, 70s, but there's not growth. There's no new access, right? That's the challenge that you're highlighting, right?
Correct. That is it. People love their heritage buildings, and we want to maintain as much as possible, but we also want growth. We see these beautiful places out in Barrhaven and Kanata and Orleans, and there's no opportunity for us at all to have a new facility. And here we are, the nation's capital and right downtown. What an opportunity it would be if we could have a new facility downtown, and for hoteliers, for businesses, etc. So the people in the area need facilities. They are diverse and quite poor, so they need to be able to walk to their facility, and it has to fit their needs.
I appreciate your intervention, and I want to clarify for colleagues so that people don't raise their hair. You're not saying that the facilities outside aren't needed. You're just highlighting a particular challenge in older lower income areas of the city. Is that fair to say?
Absolutely. And I apologize if I
No. I just wanted to clarify. Thank you.
Thank you.
Thank you very much for coming out, Ms. Milton. We do appreciate your delegation today. Up next, we have Cheryl, sorry if it's Parrot or Parrot, from the Hintonburg Community Association. Please let me know how to pronounce your name, and I promise to do so properly moving forward.
Oh, thank you. It's just plain old Parrot, just like the
right
bird,
on.
I say. Yeah. So thanks for the opportunity to comment on this draft. And I must say that working on the draft OP gave our community a much better understanding of the numbers in our community and some of the inequities. So that's a common theme today, clearly. So we hope to see better equity of parks and green space for a community like Hintonburg that has very tiny properties that now mostly fill the small lots. So parks, green space, open space is really vital when you have none of your own or very little where you live. This plan provides calculations based on the transects. So the inner urban transect is just enormous. It goes from Greenbank to Blair to Walkley Road. And that encompasses really very different communities and very different densities. So providing and comparing data on a neighborhood basis or at a minimum on a ward basis is really needed. The transect level is just too large to do that analysis. The need for parks and green space in a dense community with 8 units on a 30-foot lot is vastly different than in those with a detached dwelling on a 50-foot lot and green space privately. The previous OP aspired to provide 4 hectares of green space per 1,000 people, but this master plan is only aspiring to 2 hectares per 1,000 people, and that's disappointing. We know now we need that green space. Presently in Hintonburg, we have about 0.88 hectares of green space per 1,000 people. And with the already approved but not yet built developments that are coming our way, it will decrease to about 0.55 hectares per thousand. And that's only the start of the intensification that's coming our way. And I do question the numbers. I'm glad to hear that you don't have the population projections yet to 2031, because when I saw 20,000 increase in the urban area, I thought, I think we're getting about 15,000 here alone. So it seems vastly a very low number. So Hintonburg is quickly losing green space in yards as the building envelopes greatly increase with each new infill. The density is increasing, the tree canopy is decreasing, and buying land here is really expensive. So a solution to adequately fund the purchase of land to increase green space is very much needed, and it has to be bought. We very much support prioritizing the acquisition of new parkland and transects and particularly in neighborhoods that do not meet that 2 hectares per thousand. So it needs to go to the neighborhood level. We're happy to see the intention to acquire 18 hectares in the inner urban, but again, it needs to be figured out. You need to look at where that needs to happen. In places like Hintonburg, we already exceed the density targets in the draft OP at 88 units per net hectare, and we know that density is quickly increasing. Talking about facilities, so in the arenas, the indoor ice service provision levels in the urban transect, where a lot of the growth is projected to happen, especially over the next 10 years, is already underserved at 1 per 41,000 versus the city average of 1 per 20,000. For 2 years, urban communities have expressed concerns at multiple meetings about the closing of single pad arenas in these areas.
1 minute.
So closing out arenas and allocating them away from walkable communities runs counter to the OP aspirations. So please consider refurbishing these existing arenas, adding capacity, not just moving the numbers around in the inner urban transect as is proposed. You put a lot of money into Tom Brown Arena in recent years, so don't get rid of that. Use that use the assets that you've had and the upgraded facilities. Wading pools are really important. Kids learn to swim in the wading pools, so please keep those. And the splash pads, please don't, again, redistribute them, add more. And I just want to say about arenas, Tom Brown Respite Center has served you well during this pandemic. So please think about that of the alternative uses of just arenas. And so density is an important part of the equity question. Please consider that. Thank you.
Thank you very much to you and your community as well for being so accepting of this respite center. I know how much it's meant to our homeless population and how important it's been in the fight against COVID. Your community, represented obviously by Councillor Leeper, who has a question next, has been incredibly generous, and we appreciate it very much. So my heartfelt thanks. Councillor Leeper, please.
Thank you very much, Chair, and thank you very much, Cheryl. And obviously, I tend to agree with everything that you have said. I do just want to take a look at some of the language that is in the report. And if you bear with me just a moment, I'll try to find that again. With respect to single pad arenas, they report, or sorry, the draft plan suggests that the city strategy moving forward would be to consolidate those into 2-pad arenas that could serve larger catchment areas and could be redistributed within the transects. So when it comes to a facility like Tom Brown, what do you think are the potential implications of passing this master plan in with the wording that it currently contains?
My concern about it is that we're not going to increase the capacity within the inner urban transect. It's still going to be completely underserved by maintaining that 1 to 40,000 ratio, as opposed to trying to bring it to a better ratio. So just moving those around isn't adding capacity. The other thing is that many of the arenas that I've heard people talk about that have been threatened or talked about being closed are in walkable neighborhoods. And so then you have people that are going to have to get in their car and drive someplace else a long distance just to use the arena. It also reduces the school use of arenas. I see the 3 primary schools all bringing kids from school walking down to learn how to skate. And that's a really valuable resource. They wouldn't be able to do that if they had to hire a bus to get way out to an arena.
Yeah, I tend to agree. Obviously, you and I are catching up on this report sort of at the same time and working our way through a very large amount of material. But I don't see a lot of consideration given to, how are we going to improve 15-minute neighborhoods by ensuring that recreation facilities are walkable? And I don't know, have you seen a lot in this draft plan that speaks to that?
No, I don't see anything that really is going to improve the access for us. And with the increased density and no extra facilities, it really puts us at a disadvantage. And again, the whole urban transect, looking at it as one huge area and the numbers, I don't think tells the real tale of capacity and how underserved the communities that are going to get that really increased in density will be in the future.
Now, one of the positives that I think you and I have both identified in this draft plan is the potential to relook at the ratio of cash in lieu of parkland as it comes in. We've been speaking recently about, what if there was an opportunity to buy the through lot to one of our pocket parks? Can you give me an idea of how much it would cost to buy a typical lot that might help expand one of Hintonburg's pocket parks?
Yeah, we've been doing the math on that, and I'm thinking it's going to be in the area of about $1 million. When you buy the lot, which is just a 300-meter size lot, the price for a property that's a tear down, basically, is probably going to be $600,000 to $700,000. Then once you do the remediation, tear it down, and then if there's any soil remediation that needs doing, and then even just to put in trees, it's easily $1 million for just a tiny pocket park or an extension on a pocket park. So it's big money, and we need to somehow find a solution to getting that money.
And with 40% of cash in lieu dollars generated by projects that are, creating significant new intensification in Hintonburg, that's money that is ill lost to the ward, I think.
Absolutely, yeah. We need more money to build the pot because there's no property here big enough that you can take land instead of cash in lieu. It's just not going to happen at all. So we need to find a way to buy it with that cash in lieu, and we need more cash in lieu, quite frankly, to be able to buy it.
Yep. Chair, I'll leave it there, but Cheryl, thank you very much. I know we're going to be chatting a fair bit in the coming days.
Thank you.
Yeah, I'm definitely looking forward to seeing how the discussions play out when it comes to the new DC bylaw as well, because you're right, Councillor Leeper, there are areas in the city that would benefit from a larger split staying within the ward when it comes to CIL. My ward doesn't have a whole lot of development in it right now, and it's tough to make improvements to parks. So I hear you loud and clear on that one. Thank you very much, Madam Parrott, for joining us today. Up next, we have Jill Pratt and Nancy Wilson of the City View Community Association. I'll turn it over to you two for 5 minutes. Please go ahead.
Thank you, Chair and Committee. Jill Pro and I are the co-presidents of the City View Community Association, and we will share this presentation. The City View Community Association received notice of this draft plan 2 days ago on May the 18th. We have attended a workshop and commented in the Engage program to ensure our concerns are considered. We understand that this is in the preliminary stages, and we are just hoping that we, City View, will be taken into consideration when planning. We have not yet had time to fully review the in-depth, the 992-page report, but we'd like to make some initial comments to ensure that our community's concerns are addressed or taken into consideration at this preliminary stage. Lack of parkland and facilities in City View. We agree fully with everything that Cheryl Perot said and stated. And this master plan needs to look at neighborhood level. City View community lacks parkland and open space. In fact, we are one of the lowest ratios in the parkland in the city. Since the 1970s, our community has been trying to rectify this, yet many opportunities have been lost, and this situation is getting worse every year. Properties here are being divided to allow for the construction of huge homes or smaller lots, or on smaller lots. Also, our residential community has been flagged for even further intensification as it is proposed to be in the inner urban core transect, because we are unfortunately located close to the baseline LRT line. We note that this report has extensive tables and data on the location of facilities, yet our area has not been identified as an area that lacks facilities. The city is well aware of our deficiencies. We have no parks, no splash pads, no open space, no community buildings or programming, no bicycle paths or connections, no pathways, no storm sewers or curbs and linked sidewalks. Our community includes a number of apartment buildings and townhouses on Navajo Drive, where there is little open space with the continued expansion of Algonquin College buildings and traffic issues. This report should include a proper progressive plan on how communities such as City View will acquire recreational facilities and parks. This draft report does not address any solutions or timelines on how this will be rectified. Although we are not talking about allocation, we would like to know when this will be addressed. And I'll pass it over to Jill to finish up. Jill?
You're just on mute, Jill.
All right. This report also notes that cash in lieu of parkland funds are still being considered as a source of funding for parks, at least until September 2022. The province and the city mandates park land requirements. One of the reasons the cash in lieu of parkland policies were enacted is to enable underprivileged communities such as ours an opportunity to meet these parkland goals. Across the city, these fees are collected from developers when a property is severed for an infill and a new house is built, but not in City View. Most of the infill development in City View has not provided any cash in lieu funds for our much needed parklands. The city has been aware of these issues since January 2018, but has still never been corrected. We have an anomaly here. In 1913, over 100 years ago, the farmland here was divided into land parcels about 25-foot frontages through Regulation Plan 375. During the 40s and 50s, 3 or 4 of these small lots had to be purchased in order to support each new house. And City View became a community of modest houses on reasonably large lots. With infill development here on lots that don't comply with our RIF bylaws, it is considered that these lots are already severed.
1 minute.
And no consent is required. Therefore, CIL is not collected. Other cities base their collection of CIL when building permits are issued. We are reminding the city that these CILs need to be addressed as part of this and before this draft Parks and Recreation Facility Master Plan proceeds. In fact, the City View Community Association maintains that Ward 8 should be reimbursed for the parkland funds that the city has failed to collect. Some of the citywide CIL reserve funds could and should be used in our community, or to reimburse City View to ensure it acquires parkland is to designate our area as a special district, such as what has been done for the Preston Carling district, to allow additional funding for parks. Several senior community residents claim that City View was designated as a special district by the City of Nepean, as it was considered an unplanned community without parks or recreational facilities. Development in our community is growing exponentially, but cash in lieu is still not being collected consistently or fairly when compared to the rest of the city of Ottawa. We've been asking for this to be corrected for years, but to no avail. We would be prepared to build our own sports fields, but we have no place to put them. Thank you for your time.
Thank you very much for your presentation. Do we have any questions for this delegation? Thank you very much for coming out today. We do really appreciate it. Up next, we have Ilona Horvath, please, for 5 minutes. Please go ahead.
Thank you, Mr. Chair, committee members. My name is Ilona Horvath. I live in Lower Town East, and I follow with interest the city's work on the new official plan and related planning documents, such as this draft master plan. I would like to share my thoughts about this draft plan, and I will just focus on downtown core area where I live and where intensification has been a clear objective of the official plan. My fellow citizen, Sandra Milton, already spoke to the issues related to community recreation facilities, so I will limit my talk to park facilities. We all agree that access to green space will be increasingly important for the mental and physical well-being of residents, and parks are the most important components of green space in the downtown core. Where I see the biggest issues are the scarce resources in this transact. It has to do with the funding and properties which are available for development, whether it's parks or other public amenities. Our community will be largely impacted by the ongoing, and will be largely impacted by the ongoing constructions on Rideau streets and other developments already in the pipeline. I know larger developments require POPs, the publicly operated public spaces. And I understand this is not covered in the plan, but in any event, I think these privately owned public spaces, while they are useful, but they cannot compensate for the lost green space as a result of the development, let alone that the construction of high-rise buildings means high intensification and thus a significant increase of population. Indeed, I fully support the city planners' recognition of the growing demands and an objective to acquire new parks in the downtown core and inner city transects. However, the draft master plan does not offer much in the way of new parks in the current draft plan in the downtown core. I looked at map 21 of the draft plan, which shows downtown core transects new parkland. It indicates only one new park in the whole downtown core and a few parkettes and public plazas. In Lower Town, for example, there is no new parkland acquisition or development in sight in the next 10 years, except for an urban plaza on the Trinity development side of Rideau and Chapel Street. And a short side note, and it's not about the community, but our four-legged friends. The downtown core has one fenced off-leash park, and there is no indication in the master plan to create more, whether fenced or non-fenced. This transact is already in need of more space for dogs, and I would urge planners to take this need also into consideration. In conclusion, I would like to reiterate the importance of a financing mechanism which should facilitate that those targets in the official plan and in supporting documents as this master plan can be met. It is vital, and it is true for the present and also for the future. Thank you for the opportunity to provide comments today.
Thank you very much. Do we have any questions for our delegation? Seeing none, thank you very much for coming out to our committee today. We truly appreciate it.
Thank you.
Up next, we have Jeff Wilson from the Canada Youth Basketball Association. Welcome to the committee.
Yes, so thank you very much for giving me the opportunity to speak here. A little background on myself. First of all, I've been involved in youth sports, various youth sports in the Ottawa area for over 35 years, both in the community and then also in the school. I'm a retired teacher at this point. I'm former chair of athletics for elementary in the Ottawa Carleton District School Board. So I've had the opportunity to see a lot of different situations in terms of facilities needs. Leo hit on a lot of some of the aspects I wanted to hit on. So I'm just going to maybe add a few extra things into the discussion. The first one is that there certainly is a struggle when it comes to facilities. Our club out in Canada, relatively speaking, I consider ourselves well off. We have 1,200 participants at present, and we are growing at a consistent rate of anywhere from 5 to 10% per year. And the biggest challenge we have is facilities. The community use of schools are unable to provide us with an adequate amount to the point where we actually had to turn kids away last year. And we do everything we can to involve kids. We provide subsidies. We do anything we can to get people involved. We're at the point right now where we're looking at expanding programs. We want to be running adult programs so that we can have our former players or adults in their community involved in athletics. But again, the challenge becomes the access to facilities, especially during times like over Christmas breaks, March break, summertime, where community use of schools really hampers our ability to run summer camps or summer leagues. And on top of that is the fact that community use of schools really tries to follow an equity model where it doesn't matter what your group is doing, they can have equal access to a gymnasium. So we've seen situations where our club lost out to a group that was a remote control vehicle group where they wanted to run their stuff around the gym. When I could argue that could be done in foyers or hallways or something. We've had a seniors yoga group of 4 ladies that was using a facility that allowed our kids not to be able to use it. And basketball in particular is very specific in terms of what quality facility we need to have to be able to run our programs. Right now, if you've got an indoor court during our season, you've got basketball, volleyball, badminton, pickleball, and even futsal that are vying for the same space. And that's on top of the ancillary programs that I talked about. So one thing I think that we might want to consider is I recognize that you've got your ratios of a rec facility to so many citizens and so on. But if we were to consider sport usage in that, so how many sport participants would be vying for that facility? And that might help with identifying where some shortcomings are in terms of the facility use, because obviously there's facilities that are used by our fewer people, and you could say people talk about ice pads that are only used by ringette and hockey. Outdoor fields are only used by soccer and say flag football or ultimate. So there might be fewer groups that are vying for those facilities, and so if there's some consideration given to that, that would be good. As I said before, we're feeling a crunch right now because we do want to provide programming for ASD groups, for wheelchair basketball groups, for our adults in our community, but it's a non-starter just because we can't get the facilities. We have the resources to do it other than facilities. So and with the school board, when we do get the facilities, we can lose it just like that. The last year we were operating, we were running an annual tournament where we had 170 teams from across Ontario and Quebec come, boys and girls teams come. And on the final weekend when we've got championships, we had the school board pull the facility from us. And we had a whole division of out of town teams that basically had nowhere to play. And we had to scramble hard. And it's only through the basketball community and extended community that we were able to make it work. And so these are some of the challenges that we faced, is that we don't have a consistent facility with the school board. We are competing with multiple groups, and so even though there is a good supply there, it's not consistent, and it's not easy to access. Anyhow, those were kind of the main points. Leo really hit on what I wanted to touch as well. So I thank you for your time.
Yeah, I really appreciate you coming on, Mr. Wilson. Do we have any questions for this delegation? Seeing none, thanks again, Mr. Wilson. Appreciate you coming out today to speak to us.
Thank you.
Our last delegation is Marcia Morris. I will turn it over to you, please. Go ahead.
Thanks very much, Chair, and thank you very much. It's been a long part of the meeting, so I appreciate you very much giving me the opportunity to speak. As the Chair said, my name is Marcia Morris, and I'm the Executive Director of the Ottawa Sport Council. I've had the opportunity to present to this committee before, and I thank you for this opportunity today. For those of you who don't know us, we're a not-for-profit organization that's dedicated to representing sport in the City of Ottawa. We were established in 2013, really in response to a request from community sport organizations to provide them with support and help. We represent over 750 community sport organizations in the City of Ottawa. And in addition, we work very closely with Dan Changye's team on the development and the implementation of the municipal sports strategy, which, as you all know, is the roadmap for the future of sport in the city. I wanted to share our thoughts today about the Recreation and Parks and Recreation Facilities Master Plan. First of all, I want to thank you all very much on behalf of our sector for all the work that's been put into the plan. The plan's really important to our members, and that was very much shown by the attendance at the sport-focused online consultation session on February 24th. As was noted in Appendix E of the report, our CFS hosted 6 online consultation sessions. 212 people attended, and in total of the 212, 75 of them actually came to the sport focus session on February 24th. So that's about a third of the people that attended the online consultation. And really that consultation was all about looking at the sport fields, outdoor and indoor sport courts and amenities, and the needs of our members. It's really positive to see the development of a plan which looks forward to the next 10 years and the facilities that are required to build a healthier city. It's also really positive to see the recommendations for new facilities, including a 50-meter pool. I am a swimmer, so I love that recommendation. Also new outdoor basketball courts and new outdoor sport fields, because all of these things are needed. Having said that, we do have some concerns when you look at the Transect data and the opportunity for specific sports in specific neighborhoods, specifically in the downtown core. Outdoor basketball courts, fields, and tennis courts all have a projected 2031 provision level, which is significantly lower than the target. In the case of basketball, the target's 1 to 5,700, and the downtown core's projection is 1 to 15,300. In the case of sport fields, the target's 1 to 2,800, and the downtown core's projection is 1 to 18,300. And in the case of tennis, the target's 1 to 3,500, and the downtown core's projection is 1 to 10,200. For all these sports, there are no plans in this report to build additional facilities. However, there is a comment to consider, potentially a development. Our other concern really relates to the issue that was spoken to before by one of the speakers in terms of the recreational centers and the lack of commentary within the report regarding the ages of the centers. Well, I totally understand that there's things that are going to be done as part of the asset plan, really to compare a center in the downtown core to a center out in the suburbs that has different amenities. It's almost disingenuous within the report to say that, well, there's a center in downtown, it's equal to a center out in the West End. And I do believe that's been discussed at length, so I won't go into it, but it's definitely a concern we had as well. And further on that point is obviously the concern that was raised by Leo in terms of the lack of gym facilities and the importance of those facilities, not just for basketball, but for all our court sports, including volleyball, pickleball, things like that. These issues really become even more critical when you look at the equity issue. So map 2 in the report shows the neighborhoods as identified by the Ottawa Neighborhood Equity Index as having disparities resulting in strong equity concerns. A number of these neighborhoods are in the downtown core. And we're concerned that this equity lens hasn't been applied to the projected development of facilities, recreational complexes or outdoor facilities. When you layer the impacts of the pandemic on top of this, it becomes even more important. As I'm sure you're all aware, the pandemic has disproportionately affected marginalized neighborhoods. In the case of sport, it's really happened. There's been a great study done by the MLC Foundation that talks about the access to sport during the pandemic and how these populations have become even more disadvantaged than before. So looking at those impacts as well as what the report states, we do have a lot of concerns about facilities in the downtown core. We really believe that sport should be accessible and available to all. And as such, the sport community would strongly encourage the city to review and take these factors into consideration as the plan moves forward from draft to final status. And if this is done, the city will really better provide for all of its residents. So thank you again for the opportunity to speak with you today. I really appreciate being able to express the concerns of our members to you.
Thank you very much. Do we have any questions for this delegation? Councillor Kavanagh, please go ahead. You are on mute, Councillor. My apologies. Please go ahead. Oh, it happens. It's no big deal.
Apologies. Yeah. Haven't done that for a little while. Thank you very much, Ms. Morris. I appreciated hearing that you're working closely with the city on all the sports. I think we do need those community partners of that overview of the city, of what's going on everywhere. And I appreciate your comments about inner cities, areas of facilities, and that goes for to older suburbs as well. Man, it sure feels similar to school board, where the schools in the inner area versus the ones in the outer area, the facility difference is huge. Same problem. They just don't keep up, and it's really hard to compare them. What recommendations do you see as a priority for the inner areas? And I'm talking inner urban areas, not just downtown.
So I think one of the biggest recommendations has to be along the lines of what Leo stated, which is in terms of both fields and gymnasiums. If you look at the sport that is most played in the inner area, basketball and soccer are the two most played sports. We had the opportunity to run a pilot program a couple of years ago in Lowertown Sandy Hill, our Rito Vange multi-sport program. And we ran sport opportunities for children in that community. We actually had to go into the schools because there were no other facilities. And we had to do it in partnership with the schools. We received a $300,000 Trillium grant to expand that pilot. And because of COVID, we have not been able to do anything because we can't get access to the schools. So granted, COVID, we've been going back and forth, opening and closing and whatever, but we don't even know if we're going to be able to run that pilot, that expanded program in the schools this fall because of that. So if there were facilities that were available to be able to run that, we would be better serving the needs of all of our residents. So I completely agree with the dearth of facilities in terms of gyms, and then that also gets expanded to soccer fields as well. And those are the two predominant sports.
You're still on mute, Councillor.
Sorry, I keep putting it off because of the noise back here.
Totally.
Is it possible to look at domes as well as gymnasiums? Did they solve the problem as well, like the covered domes?
Certainly covered domes would solve the problem. The problem with covered domes is, and as I think that one of your previous speakers, Jeff, could speak to, the rental fee for a dome is significantly higher than the rental fee for a gymnasium. And so what's happened, and one of the reasons that youth haven't been able to access any facilities within the COVID pandemic, or youth that are marginalized, is because the access fee all of a sudden went up. So when you're paying, in excess of $100 an hour for a dome space versus, $20 or $30 for a gym space, that cost has to be dispersed across your participants. So all of a sudden, where organizations were able to offer sport, prior to the pandemic, during the pandemic, those organizations haven't been able to offer it to youth who might have been able to participate before, because the cost is just prohibitive.
Thank you. And what about gender equity in terms of sports? Is there anything that you could add of how we can do better?
The city's doing an amazing job with its Girls and Women in Sport program. We actually are applying for funding from the Ontario Trillium Foundation about creating a diversity, equity, and inclusion initiative for community sport. So many community sports are coming to us and saying, I know we have to do something better. So not just about gender equity, but all equity. And they understand that they need to do something better. The reality is that 73% of our community sport organizations across Ottawa, just as across the country, are run by volunteers. And in many cases, they don't have a staff person that can put an initiative like that into place. So we're applying for funding from Trillium to create a DEI initiative to help community sport be more equitable, diverse. So that would include gender, that would include people of color, so the whole gamut of how can we ensure that our community sport organizations better represent our population and are better providing abilities to participate and in their neighborhoods, and making sure that we're meeting the barriers that already exist.
Okay, thank you very much. Thank you, Chair.
No problem. Councillor King, please.
Thank you, Chair, and I'd really like to thank Ms. Morris for her presentation and build a question based off of what my colleague, Councillor Kavanaugh, was asking about around diversity and inclusion. You have said that you are looking at a new initiative. I'm just wondering, are you also working with the new anti-racism secretariat at the city on these issues? That new anti-racism unit at the city will also be looking at youth development. And these are some of the questions that we heard when we were undertaking consultation, that there's a lack of recreational opportunities in especially inner core areas. So I'm just wondering what type of interaction in terms of this proposal are you having with the city?
So thank you very much for your question. Right now, none. Would I love to? Absolutely. I would be so delighted to be connected. I know that it's a requirement. In many cases, I'm trying to figure out where to start. So where I have started is working with my sport community partners. So I'm working very closely with the MLC Foundation, with MLSE, with the Canadian Tire Jumpstart, from a sport perspective of what needs to be done. And what I was trying to do is understand at that lens what had been done. Then definitely bring it down to the city lens. So I would be so happy if you could connect me in, or somebody from your staff could connect me in, because that's obviously, we want to make this applicable and appropriate for Ottawa and be bringing in a solution that takes best sport practices, but is rolled out in our setting.
Well, I appreciate that. I don't sit on this committee, but one of the things that I did notice in the document is an omission about the anti-racism secretariat in the equity area. And I think that is something that might need to be given some due consideration. I understand, of course, that this document was being prepared probably before the anti-racism office. And of course, it does talk about gender equity. And of course, there is an intersectional approach that we take around that. But I would suggest to staff that there be direct linkages to the anti-racism secretariat in the end document, so that we can build these connections with wonderful community groups and organizations that are working on diversity in sport in our city. Thank you, Chair.
Thank you very much, Councillor King. Thanks for joining us today. Really appreciate your contribution. Does anyone have any further questions for Marcia? Seeing none, we'll move on to questions to staff. So please indicate whether or not you'd like to ask questions to staff on this. Vice Chair Eglai, please.
Thank you very much, Mr. Chair. I'd like to follow up on a couple of recent comments and delegations around the equity issue. And particularly, I want to talk about the cost of sport. So certainly when you look, and a lot of references or comparisons have been made between not football, but hockey and basketball, for example. Hockey can be an extremely expensive sport. And whereas basketball and soccer, for example, tend to be sports that are not nearly as expensive for the participants. I've coached both soccer and basketball. Even basketball, despite my 5'6" stature, I did coach basketball, and I could see that every day that we went out for practice or a game, the number of kids that were participating that wouldn't necessarily be able to participate in some of the more expensive sports. And I hate to keep on singling out hockey. There are others that are expensive as well. So I know we're talking a lot about facilities here, but I'm wondering if the city has turned its mind at all to how we get to those kids in our communities and their families that don't have a couple of $1,000s a year to pay for sports events or sports activities, but could buy a pair of cleats and shin pads or a basketball and some running shoes and be more engaged. So how are we reaching out to those groups to make sure that the kids are engaged and they're getting physical activity and they're getting all the benefits of team sports, the idea of working together and team loyalty and cooperation? What are we doing to get there? And is it doable with the existing to build momentum in those areas with your existing slate of facilities? Or do we have to look at innovative ways to find more facilities or more partnerships, if you will? Maybe next time we're building a large rink, indoor rink, maybe part of the discussion is, well, we also want to have a gym attached to that rink as part of it. We're breaking ground, we're doing a big construction project, roll that in the way we often roll in other pieces to road projects, for example. We're in there fixing pipes under the road, so let's do road renovation on top and put in a bike lane or a signalized intersection, what have you, because the main cost of work is already there and we're just rolling in additional pieces that are easier to do because we have the people on site and the work underway. So that's a very long question, I know, but what I'm really trying to get at is how are we getting to those families and those kids that don't necessarily have the money to play the higher end sports in terms of equipment, insurance, and that sort of thing? And do you feel that we have enough within our catalog, if you will, of facilities and type of facilities to achieve that, or do we have to be looking at the use of those facilities and the development of new facilities in a different way?
Councillor, that does cover a lot of turf, but let me start, and then Kevin can pipe in on the more specific capital side of this. And some of the comments today on hockey versus basketball, made reference, for example, to the Sens rinks that have been funded by the Sens Foundation in the past. And I would point out that in almost every case, we have built those new rinks in communities that were equity seeking, that were had inadequate assets in their neighborhoods. So we have built them in Bayshore, we have built them in Overbrook, in Ledbury, in places like that. And that's not just on us, that really was the Sens Foundation's mandate to do that.
And Dan, if I could just interrupt quickly, I appreciate that and I understand that. I'm more talking to the attendant cost of being able to participate in the sports that would happen in a facility like that.
Absolutely, and the side that we are looking at that as well. Earlier this year, we did a realignment within my department to create a new grouping of facilities and programming staff to take a different kind of more neighborhood focused basic level of service offering, which we are in the process of rolling out. We have worked with Donna Gray's team and the equity seeking programs. They have helped us with some funding in terms of equipping facilities in neighborhoods that had, primarily inadequate equipment and supporting amenities to the program. We do need to look at how do we get beyond just rental programs for bringing communities into hosting more of these things in partnership with groups. So that is a work that has started, so that when groups are doing something that brings a program to a neighborhood that needs that programming and the kids or the adults for that matter can't afford it, how do we work out a partnership that takes it away from a rental situation into a collaborative partnership situation, so that it lowers the cost for them and it lowers the cost for participation. We are also working with a lot of the foundations, and Jumpstart has been mentioned. We've started to roll out, I love to skate, I love to learn to play hockey, I love to learn soccer, which is bringing third-party funding into city operations so that we can afford to do that. So the focus of the new entity created in the department is going to be very much that. To your question, do you have enough to do it? No, we like many of the groups you've heard today have been impacted by reduced access to schools across the city. Part of that is the extended school day, the from early morning to aftercare, which pushes back the cleaning of the schools, which reduces the envelope of time. So programs like our Women in Sport program and a lot of our other community programs that have relied on school gyms and other spaces have been impacted with that. We do need to sit down with the school board post-pandemic to review where we are at with all 4 school boards, because they're, we've talked about them as a unified block, but it is quite different with each one. And we do have that on our work plan to look at how do we renew that relationship once they are in the process of wanting to renew the relationship to bring school sports programs back into our arenas and our pools and those kinds of things, because we do have the basis for an exchange of service that I think needs to be brought into post-pandemic, new era of longer school days. How do we make that work? Kevin, I don't know if you want to add from the facility side to that.
Yeah, thanks, Dan. And yeah, so I just want to bring back to focus for everyone that the Parks and Recreation Facilities Master Plan is looking at buildings. It's not looking at how they're operated and not how they're programmed or allocated. But in thinking back to some of the delegations we saw today, a lot of the concern was about how are we going to accommodate growth within the core. And let's face it, we're not making new land inside the core. We have to find what we can or make use of what we have. But I'm thinking also to, there was a reference to arenas, for instance, and we do make a suggestion in the report that do we look to consolidate single pads into twins? But that doesn't mean that the single pads that are there right now are locked up and sold per se. This would be part of a process going forward. But if we identify needs for inside the core, if you think about an arena, it is a giant barn shape. What else could we put in that barn? What other services could we put in there instead of being iced? Can it be a hardwood floor? Can it be various other types of facilities? So that is our go forward. Right now, remember, we're looking at level of service per 1,000 people. And this is trying to set us a benchmark as a go forward for when we start thinking about whether it be a renovation replacement through an asset management program, whether it be seeking opportunities, we need a benchmark to go from. And that is the goal of today. And that is what we're looking for today. I can't speak to the affordability of using our spaces because we, first of all, in my very limited opinion, need to provide the spaces so that we can actually then have that conversation.
Councillor, I can add, because it was brought up today, the arena optimization initiative that council approved did ask us to look at opportunities to review existing single pads that are end of life. Average age is 46 years. And we have paused that right now, and exactly why because of what the delegation mentioned. COVID has brought a new lens to this in two senses. One, those big downtown facilities, and if you think of Tom Brown, McNabb, Bernard Grommet, they have all served valiantly in terms of respite centers or vaccination centers or those kinds of things. So we need to reconsider the municipal need broader than recreation for those. But always as an intent, as that Kevin mentioned, were things that have been proposed, like indoor skateboard parks, indoor multi-court, pickleball, volleyball, those kinds of things. And of course, basketball. So they're very versatile spaces that a second consideration of letting them hang around with a second life, and also behind in our minds that as an emergency response center, they are really handy to have. Perhaps not for all of them, but certainly for some of them, we have mapped out that a repurposing could help in the indoor space, especially in those neighborhoods, because those of you who know the inner core will know that Old Ottawa, perhaps the 15-minute neighborhood was ahead of its time then, but was known for building small facilities as opposed to complexes, but building a lot of them. And because of that, we don't have a lot of gyms, but certainly these aging arenas might be a good opportunity to fill some of that gap. And that's certainly part of the plan when we resume. The other side we have to look at is the lasting impact of COVID on arena sports, because there's differing indications of what it's done to sports leagues and how strongly it will come back, and demand for ice time and those kinds of things. Thank you.
No, thank you for that. And I'm particularly interested in the piece about repurposing some of the older facilities and changing them over to more multi-purpose, indoor soccer, basketball, all those things, which again, can be much less expensive for a family to have their kids access and get physical activity. So I wish you well on that endeavor, because I think that may be a very smart way to repurpose what we have and create more facilities at a lower cost. So thanks for that, Dan, and Kevin as well.
Thank you very much. Councillor Leeper.
Thank you very much, Chair. So philosophically, I just wanted to take a look. I'm not going to delve deep into the weeds of this today, because obviously we have several months ahead of us to take a look at the numbers and come to grips with them. But I think I want to make sure I'm accurate in how I'm portraying this to the community. In the inner urban transect, which largely encompasses a lot of older City of Ottawa facilities, it looks to me like we are actually over-provisioned for some of the key amenities that residents enjoy. As opposed to, say, the downtown core, I think the inner urban transect has got a lot of community centers and things like that. We're not proposing to build any more. So I just want to make sure that when I go out to the community to talk about what this plan means, is that we are going to, over the course of the next 10 years, see the existing facilities become more and more pressured by population growth. So every year, those ratios are going to become more and more challenging. We're not going to try to bring the rest of the city to the kinds of ratios that might exist for some of the amenities in the old City of Ottawa. Rather, we're going to see our facilities be more pressured in line with other facilities around the city. Is that philosophically essentially what's going on?
Mr. Chair, thank you, Councillor Leeper, for the question. I just want to point out Dan's opening remarks and my remarks that were made during the presentation. What you see from a projection right now is based on data we receive from growth from Environics, not from OP. Environics is not privy to where the official plan team is demonstrating intensification and growth, whether it's the core or the greenfields, it doesn't matter. Environics is based on a straight line projection based on historical numbers. So the point of our whole report today is the ratio of how many, say, community centers per 1,000 people. I think we're at somewhere between 19,000 and 20,000 people per community center, for instance. So if an area like, say, for instance, Hittenburg or Mechanicsville, when OP comes out and says, well, Environics said you're going to grow by 4,000, but because of OP changes, it's going to grow by 24,000, our numbers must change. And that is what will be coming forward.
And I'll be curious to see what those ratios do. And you've raised a really important point and a fundamental point to the discussion today. If the official plan is walked back at all in terms of intensification in some of the areas of, the inner transect and the outer urban transect, council is going to have a choice as to whether or not to significantly increase intensification in some parts of the city or expand the urban boundary. That's going to be a tough decision depending on the extent to which any of the proposals of the official plan are walked back. And it strikes me as it may be premature at this point to be approving this plan without understanding its implications for particular neighborhoods, given some of the uncertainty around the official plan numbers. Like, I know you're setting up basic ratios, but how close we are to those ratios is going to depend on intensification targets over the course of the next 10 and 20 years.
Yes, and if I had anything to add to that, Councillor, it is simply that, of course, we are tied to official plan. So if the plan changes, we must change as well.
But I want to come back to the to this question of the ratios, because there are some significant inequities in ratios between the transects for the various different amenities. Sometimes the downtown core is seriously under provisioned. Sometimes in the inner urban transect, we have far more splash pads than the target recommends. And I think, it's important to understand that if we pass these ratios, that the intent is not to even preserve the splash pads that we have, but to redistribute those around other transects so that everyone comes to a ratio number that is citywide, as opposed to bringing the rest of the city up to the standard that's already enjoyed in transect X.
In both Appendix A and Appendix B, you will not see us suggesting that we reduce service levels when existing facility service levels. I mean, there will be a recreation action management plan where there will be perhaps a discussion around making sure to maintain our ratios, but that's a future discussion. The point, again, I'll reaffirm, is as growth occurs, we need to have a basic ratio to make sure that we keep up with growth.
But there is, I want to make sure I'm accurate when I'm talking to community members about what this means, and splash pads are an interesting one where we're proposing a ratio of 1 to 7,300, and in order to do that, you're proposing to build new splash pads, which is fantastic. But the line in the draft plan is, as existing splash pads reach end of life, consider rebuilding these facilities in transects that have low provision rates. And I'm sorry, I don't have the number for the inner urban transect, but I suspect that we have more splash pads than the target number would indicate. And the plan would reduce the number of splash pads in transects that have more than the target in order to build more of them in areas that don't.
Mr. Chair, to Mr. Lever, I don't have the precise numbers in front of me at the moment, but we will look at that. But the real point I simply want to make is that it is my impression that splash pads are actually the most densely provided in the suburban areas as part of new park development. And my observation is simply because of the evolution of splash pads as an available amenity is truly in the last 20 to 30 years versus what's available in the core, especially the core and also the interurban. Speaking candidly about our workload in my group and my department, splash pads inside in the interurban and in the core are few and far between compared to the level of service we're providing in particularly greenfield developments.
Okay, and those are some of the numbers. I think a summary chart is something I want to create over the course of the next couple of days, so it's all at a glance. The acquisition of parkland is going to be extremely difficult because of the price of land, and I'm pleased to see that you're thinking about the CIL split between the ward and citywide, and obviously I've got thoughts on that. One of the causes for cynicism among residents about the acquisition of land will date back to the Humane Society opportunity, and I don't want to get too deep into what happened there, but how can we define and create a clear roadmap to the acquisition of private property in order to expand green space associated with existing parks and create a process that lets everyone know what to expect? So we currently are having a discussion about Yves Tremblay Park, where there is a lot that is almost certainly going to be developed. The secondary plan speaks very vaguely to it. There's no guarantees that the city will in fact acquire the territory or the property that it has said it wants to acquire. How can we provide residents some certainty with respect to that?
I'll let staff respond, but that's your time, Councillor.
Thanks.
Thank you, Mr. Chair. So there's a few things there to unpack. First of all, cash in lieu of parkland and a strategy regarding cash in lieu of parkland. We intend in September to ask Council to direct staff to review the park dedication bylaw, which is what is the mechanism that creates cash in lieu of parkland, how it's calculated, how it's split, how we move forward with it. So this master plan does not address cash in lieu of parkland from a change to anything that is current. It simply makes recommendation that we consider. And the reason for that is that, as you mentioned, we recognize a deficiency in parkland, so we need to recommend strategies moving forward as to how do we achieve balance or repairing the missing pieces of parkland. One other thing we are recommending as well is a real estate acquisition strategy. How do we get these lands? And there's many ways that it can be done. We posit that when city sells its own land, is like we do for housing, is there a benefit that could also be that could go to parkland? Do we have are we able to create policy that makes the city more nimble when it comes to purchasing land? Those are the things that we are going to go to council for direction to staff to consider after OP is approved.
Yeah, I know I'm out of time. Thank you very much, Chair. Thank you, Kevin.
Thank you very much. Listen, committee members, there are a couple of members of this committee that have a hard stop at 1:30 for an OPS event. There's quite a bit of crossover between our committee and OPS. So just by just a quick show of hands, because I do want to make a decision based on the will of the committee. Would you just, as a quick show of hands, let me know if you're okay with pausing this item for a quick moment so that we can go back to item number 1, deal with it, and then return to this? You would not lose your speaking order that we have right now. So if you're okay with that, just going back to consider that other item, can you just show me your hand, please? Seems to me that we have a majority of committee members. Okay, so we're just going to pause this item. So up next will be Councillor McKenney, and then Councillor Kitts, and then Councillor Fleury, and then Councillor Kavanagh. So you will not lose your spot in the speaking order. So we'll return to item number 1. We do have a motion on the floor. Because this motion deals with some items that are outside of the scope of the report itself, and because it is coming to committee today, we do need to vote on waiver of the rules to consider the motion now. Otherwise, it will be a notice of motion for the next meeting. So please, I would like yeas and nays on waiving the rules to consider the motion.
Mr. Chair, point of order, can we speak to the waiver motion?
Yeah, sure. Yes, of course. So motion to, so we'll move a motion to waive the rules to consider this item now. Anyone who wishes to speak on that, please place your hand up. And I see that I see that Councillor McKenney and Councillor Kavanagh still have their hands up, but I think that's on the other item. Okay, great. So Vice Chair, please go ahead.
Thank you, Mr. Chair. To me, it makes sense that we do not waive the rules and treat this differently for a number of reasons, not the least of which is, at best, this motion is tangentially connected to a report that we had today. We don't have staff here to explain what they've done or haven't done. The motion assumes that staff needs direction to do certain things, when we already had a motion passed some time ago that Councillor Menard referenced, which gave staff direction. So to me, introducing it today is fine, and dealing with it at the next committee meeting gives staff an opportunity to wrap their heads around what's being proposed. Hopefully attend at the next meeting to be able to answer substantive questions about what they've done thus far on this plan, what they've done in response to the earlier motion that Councillor Menard referenced earlier in the day. It gives everybody a chance sitting around this table to make an informed vote rather than making a vote on the possibility that maybe staff isn't doing what they're supposed to be doing. We don't know that. There's nothing in front of us to suggest that. And staff would be in front of us. We're also dealing with agencies that do not answer directly to this board or to council. You mentioned OPS and need to stop for OPS. OPS is one of those agencies. OPH is another one of those agencies. We're talking about community stakeholders and partners involved in this process as well. So I think for transparency's sake, for equity's sake, for fairness, we should give staff the opportunity to provide us the opportunity to ask any questions we may have around what they're doing, why they're doing it, how they're doing it, where they think they're going to be by the end of the year, when they think they can roll out the plan, all of those things. And then we can do what we're supposed to do, what we're elected to do, which is to make an informed vote, rather than jumping the gun today, waiving the rules, having a vote, and then potentially redoing the whole thing again at council when hopefully those people can be present. It means a short delay in what Councillor Deans is attempting to achieve. And I'm not saying it's a good or a bad thing. I'm saying we don't know. We don't know because we don't have the information in front of us. We don't have the stakeholders in front of us. We don't have staff in front of us to answer those questions. And we don't have a report that we can ask questions about and look at what they have or haven't done. So I'm not saying don't deal with this motion. I'm saying, please don't agree to waiver. Put it over in the normal course as we would. It's a motion introduced. Give staff, as I say, an opportunity to wrap their heads around it, be present at the next meeting, answer our questions, and then, as I say, we can make an informed vote at that time. Thank you.
Thank you for your thoughtful comments. So we have Councillor Deans, please.
Thank you, Mr. Chair. Members of committee, I would ask you to suspend the rules and deal with this item today. We heard Mr. Poirier say when he did his paramedic presentation this morning that he will be developing a mental health strategy to put before this committee in the fall. Today is the 20th of May. If we delay a cycle, we won't have this issue in front of council until July. And that is way down the path if he's going to have a mental health strategy developed and in front of this council this fall in Q3. So if we want to do this right, we need to do this now. If you pass this today, if you allow this motion to be put on this committee agenda, you pass it today, all of the people that Councillor Eglai has indicated he's concerned about will have the opportunity to review the motion between now and council and weigh in. And if they have any changes or suggestions, they can make them at the council meeting. This is actually providing notice in a timely fashion, but keeping this ball rolling. And I took the opportunity to go back and have a look at the motion that Councillor Menard put. And I can tell you that that motion specifically speaks to OPS having the lead. And I can also tell you, as the chair of the OPS board, that we are very happy to be at the table. We want to be at the table as a full partner in the discussion. But we have been hearing loud and clear from the community that they don't want police leading this. They want the community safety and well-being plan to be the lead, to be the umbrella under which all of the partners come together to develop one strategy. And we're off on the wrong foot. So we have to get there. We have to get to the right place where we're doing a one whole city approach to mental health response. And the sooner we get there, the better. And that's why we need to keep this moving. That's why we need to address this today. And I can tell you that all those players will have all the opportunity they want at council when this is in front of the council to make any suggestions. They can call me, they can in the intervening time between now and the council meeting and make suggestions. If I will be open to amendments to that motion if they need to, but we need to keep this rolling. So I would ask you to suspend the rules and allow this motion to go on this committee today. Thank you.
Thank you, Councillor. On referral, Councillor Dudas, please.
Just for my clarification, I know I'm speaking to referral. If we do waive the rules, we do speak to this motion today, is staff prepared to comment on their thoughts on it? Because I'd love to get their input. Like, is Pierre still there?
I don't believe we do have the appropriate staff here, unless Chief Ayat would like to comment. If this does pass today, and it will go to council, and we'd have the full slate of everyone here. But if the acting director wishes to speak to this, please go ahead.
Yeah, thank you, Chair. Obviously in the hot seat on one of my first committee meetings, but happy to be here nonetheless. I do believe that the Community Safety and Wellbeing Plan does have a coordinated approach for the city, and it does have council-approved priorities, mental health being one of them. When we're talking about paramedic response, we're talking about emergency response, and I think the intent of what the chief was saying, and he could elaborate on this if necessary, was that we need the right tools to attend the right calls. And the program he's talking about is getting properly trained paramedics in mental health response to go to mental health calls. As part of the overall bigger strategy, this little component is what he's looking at. And I think that that's a necessary review. It is a best practice in other countries. And we're simply looking at expanding what we do from a paramedic response perspective, an emergency response perspective. It's another diversion program, quite frankly. It'll help eliminate mental health patients going to hospitals and going to proper facilities and getting proper help. As for EPS taking the lead, I'm not convinced, and again, this is me, but I am speaking as the GM, that this falls within our business line and that we have the expertise to actually prepare this plan. And I think that it might fit somewhere else. Quite frankly, I'm concerned that you're asking us to do something that falls way outside our expertise. As for timelines, with the pandemic, I have real concerns with resourcing this and moving forward, prior to budget deliberations or budget discussions of 2022. So those are my initial thoughts, just based on the discussions I've heard today. Thank you very much.
Thank you very much, Chief. I think from my perspective is I think the premise of the motion is valid, and I would love to have that discussion. I know I'm still talking about waiving the rules, so I don't see a problem with waiving the rules to have a discussion about it. What I do have concerns about is, one, we don't have the information in front of us to make an informed decision, even if we do have that discussion. And the fact is, I know a lot of first responders, and a paramedic may not need the same I don't know. I'm not an expert, and I don't think we have the experts here to say whether a paramedic needs something different than a firefighter or a police officer, or that the response is in these circumstances. And when, you know, Mr. Poirier was speaking, he was saying he's already doing work, and he's not here to tell us what the work is that he's doing. So, you know, I'm eager to hear what Councillor El-Shantiri says, but honestly, you know, until we have the right players at the table, I'm very reluctant to make a decision on this. I'm happy to have the rules waived to have the discussion, but I don't want to vote this down because we don't have the right information.
Councillor El-Shantiri, please, on referral. Sorry, not on referral. My bad. On waiving the rules.
Well, Mr. Chair, I have, you know, I've been thinking about this, and I know how important that this item is, but also in the absence of our professional staff who's going to advise us on this, can we send this motion to council without any, you know, without any direction, and hopefully from now till council meeting we can, you know, we can have that discussion with the chief medical officer, with the chief of police, with chief fire and paramedics, and have some kind of parameter, some kind of discussion. I mean, if you put the motion right now, I'm going to vote it down. I'll tell right now, and I hope my colleague will vote it down as well. But if you go take it to council without any decision on it, and from now till council, send that motion with your, you know, with your blessing to those general manager and the chiefs, and get their opinion on it. I think that will be something we can have the open discussion, and with the professionals in the room to advise us, because I don't want to give Dr. Vera another headache with other workload, or to the chief of police. I mean, you have to remember where we are in pandemic and short staff and others. So if you need a vote today, I'm going to vote down this motion. I'm going to vote against that motion.
Councillor El-Shantiri, are you moving referral?
I would like to move a referral to council without any decision, A or nay on it. Just send it to council without any position on it until we hear from the other. And if the other have enough time between now and the next council, it's fine. If it's not, maybe the council after that. I'm just trying to give them time to tell us and tell the chair of the public health and the chair of police board and other, what's their position on this.
Okay, so we now have a new motion that supersedes the original one to waive the rules today. Does anyone wish to speak on referral? Councillor Fleury, on referral. I guess my Freudian slip earlier there kind of forecasted this, but on referral, please go ahead.
Yeah, look, I think we all want to do the same thing. We have different ways of going about. I think giving us times to refer to council and giving that extra time so everyone's aware, and if there are amendments to the motion, achieves exactly what I think Councillor Deans is trying to achieve at committee today, but gets consensus. So if we can, I'll support referral if it means that the approach is cohesive, coordinated, and that the motion is in front of council for discussion and debate at that point. So I'll support the referral.
Listen, I'm prepared to debate this motion today, but whether it passes here at committee, I think that it should with an endorsement from this committee. But if it is referred to council, it will be discussed on the same day whether or not we endorse it today. I think that it should go on endorsement, but I'm at the mercy of the committee's will. So on referral, Councillor Eglai.
Thank you very much, and I want to thank Councillor El-Shantiri. Continuously he shows us his experience from being on council as long as he's been on. I mean that in a very positive way, Eli. I think that's a very elegant solution. It answers my concerns, I believe, and the concerns of the agencies to have an opportunity. To the chair's comments about wanting to endorse it, I want to endorse it with a foundation if we're going to endorse it. And the only way we're going to get that foundation is to have full debate with all the people we need in the room to answer the questions. So I'm not saying this is a bad motion. It might be a very good motion. What I'm saying is we need to fill in that foundation to be able to make that decision. And so I wholeheartedly support Councillor El-Shantiri's suggestion or motion rather that we do refer to council and give staff a bit of breathing room and be able to come and speak to it at the council meeting. So thank you for doing that again, Councillor Centuri.
Very much appreciating the respectful interventions here on referral. Unless Councillor Deans, we do also have Councillor McKinney that wants to speak on this. Do you want to speak on wrap up, or would you rather speak now?
I'd just like to speak now.
Okay, please go ahead.
Thank you. I'm fine with referral. As long as it goes to the next council meeting, I'm absolutely fine with that. And I'm absolutely fine with having all of the people come to the council meeting, the chiefs, the Dr. Etches, everyone else to weigh in, because I think this is an important community discussion. We just need to get on with it. But Mr. Chair, the reason I want to speak now is from a procedural standpoint. I just wanted to point out to you that you must waive the rules in order to refer this motion to council, even without a recommendation.
Well, we have Councillor El Shantiri showing his longevity and knowledge of the rules. I could fully admit that one slipped away from me, and I do appreciate that. So first then, on waiver of the rules, yeas and nays, please.
Just carried.
Carried?
Carried.
Carried. On
Carried.
referral?
Carried.
Carried.
I think the clerk wants to say something. Caitlin, sorry, Mr. Chair.
Oh, and Mr. Chair, no, I was just, my sound was cutting off at exactly the crucial moment. So apologies for my pained face.
No problem. So this motion is referred to council. I think that what we've achieved here is maintaining the timeline that Councillor Deans intended. So thank you both for the committee for working with us on this and also for the cordiality that we've certainly come to expect over the course of the last couple of months. So thank you very much on that. So if we don't mind, we'll dispense with item number 1 before returning to the other. Is the report on the Ottawa Paramedic Services, is that report carried? Carried?
Received. Wasn't it?
Received.
Oh yeah, sorry, received.
Received.
Received? Wonderful.
Received.
All right. Thank you very much for indulging me in some procedural gymnastics. I truly appreciate it. I'm definitely learning a lot as we go through this. Returning to item number 3 with questions to staff, we have Councillor McKinney, please.
Thank you, Chair. Thanks, staff, for this draft plan in front of us. I know how much work had to go into this, and the scope and the diversity of the city and the needs in the city are tremendous. And so I do want to acknowledge that that it's not easy just to get to here, and now we're kind of pulling it apart by threads, but that's our job, is to pull out our threads. And when you look at a city as diverse as Ottawa, when you look at, say, suburban South and their need for recreation centers, like, there's absolutely no doubt, like, it's such a growing population, just not enough in terms of amenities in our suburban South communities. So I think that it's important to recognize when we are jockeying for what we feel we need in our communities, it should not be at the expense of other communities, because we've agreed to be one big city, and that's the only way that we're going to thrive is to build that equity into our communities. So I am going to talk today about the needs for the downtown core, and just trying to understand when you consider, for example, recreation complexes or community centers, and you have a number per residence. Would plant pool equal 1 versus sportsplex equal 1? Are they, when you talk about just supply?
Mr. Chair, thank you for your question, Councilor McKinney. When you talk about plant pool, you talk about a pool. Is the Sportsplex a pool? Yes. Is Plant Pool a pool? Yes. So when I talk about pools, they are both pools, absolutely.
So when you talk about recreation complexes.
So a
And-
recreation complex, sorry to interrupt. Did I interrupt too soon?
I just want to make sure that I understand what you're counting. So when you say a recreation complex, in my estimation, you would need to put together, say, Plant Pool, Hintonburg Community Center, probably McNabb, Tom Brown, the Patro, and Champagne, and you still probably wouldn't have everything that is at Walter Baker, for example, or Sportsplex. But you would certainly have to cobble them all together to get one major complex. So when I look at this, and we said downtown core, no planned facilities for 10 years for recreation complexes and community centers. I'm just trying to understand what we're counting when you say we have a provision level of 1 to 20,000. Is that one, like, is that plant?
So plant falls under, I believe, the 1 to 20,000, but not because it's a complex, but because it has a pool and it has indoor space, community indoor space, closer to community center than a complex. When we speak of complex, we speak of something a lot more diverse than what you see offered at plant. For instance, it has no arenas. It does not have a full-size gymnasium.
Right.
So
also, go ahead.
Sorry. So if I were to continue that thought, if due to growth, plant needs improvements, it should actually require things like perhaps a twin pad arena and gymnasium space in order to qualify as what I would consider a complex. Like I've heard a lot of mention of some of the suburban developments. So I'm most familiar with the Minto Rec Complex because I happen to be personally involved in that project, and it's a twin pad arena, it's a gymnasium, it's a swimming pool, and 2 larger size multi-purpose rooms and some minor spaces after that. That is not plant.
Exactly. So that's kind of my point. And so I'm not looking for a twin pad arena at plant, just FYI, because I need that green space. So I think we've had this conversation, but now I've said it publicly. Find room somewhere else, but not here. But we do need, so plant, at least a year and a half ago, was #1 in memberships for the entire city, for memberships. And it's a small little, whatever you call it, complex. And we cannot, in the neighborhood, get our kids into swim lessons. Like, it's very, very difficult. We have absolutely no meeting space. So I just wonder, and there's a lot of employment in the area, and people, and rightfully so. So they should. We want people to come from other areas to use the pool if you're working. But have you taken that into consideration? The not just the density per residence, but who is using the complexes? Because if you have a complex that's highly used by employees in the commercial sector, I think that you have to take that into consideration. It just means there's less recreation available to the people who live in the neighborhood.
Through you, Mr. Chair, a friendly reminder, we're looking at development of facilities or built form versus program and allocation.
No, I understand that, but we need a bigger facility to be able to program, right? Like,
and no, I know. And the second reminder I was going to have, we're not really talking about specific facilities here. We're talking about growth by Transect, by how the level of service we provide. That level of service by resident is based on, first of all, best practices, and also our benchmarking across municipalities across Canada, and also servicing let's just say the lunchtime office crowd, for lack of a better way of explaining it, is definitely not something that we have factored in. And this is because there's employment centers, first of all, throughout the city. I mean, I could reference the Richraff Rec Complex in Canada North as well. And again,
I'll give you Canada North, sure.
I don't want to talk about areas in that sense. I'm just saying that when it comes to how we provide facilities and how we actually get funding facilities is based on growth of residential units. It's not based on growth of office spaces, or perhaps the decline in current office space would make me rethink things as well. We don't have the luxury of focusing on, let's just say, the dynamic environment of everything that happens within our city, or everything that happens in an area of the city, other than the residential happenings within those city, and that's our primary focus, is on growth in residential, and how do we accommodate the growth in residential.
Councillor, it's Dan. We've had a similar discussion with Councillor Fleury earlier this week, and we have agreed to have a look at if there's other best practices in other dense urban centers. And we were thinking downtown Toronto, for example, where there's quite likely the same dynamic where a facility that was perhaps at one time built primarily for residents is all of a sudden primarily for noontime workers or after work crowd, those kinds of things. So we don't have the answer because we've only had this discussion, and we hadn't looked at that in phase one. But through discussion, there may be something out there that would fit within the parameters of a master plan, and that would be accepted through the OP and through whatever other provincial filters we have to look at. And so we are prepared to look at that to see if there is either an adaptation of what we're doing or something completely different that can be tagged onto it. But I can't be any more descriptive than that because we haven't fleshed that out yet.
No, okay, I understood, and I don't disagree. Can I just ask how sorry, are you telling me my time's up, Chair?
You have about 20 seconds left, Councillor. Please go ahead.
Okay. How are you factoring in the new space, the new green space at 1010 Gladstone and 1010 Somerset, and how it relates to the new housing at Gladstone Village? How does the draft consider that?
Through you, Mr. Chair, the 1010 doesn't currently exist as new parkland, so it's not captured in our snapshot of time.
Fair enough, but presumably it will turn into a sports field or some, we're gonna talk. Do you want me to go back on the list, Chair? I know I'm going over my time. Okay, this is my last one. But presumably it's going to turn into, we're going to consult with the community, find out what they need, they want. But let's say they want a new sports field, which is what I'm guessing they want. That's what they keep telling me. How then, if we have a draft plan here that says no, that's not what's happening in the downtown core, or there's no provision for expanding plant. How do we ensure that 1010 Somerset, once we do own it, once it is programmed, that we're able to accommodate for those needs?
Again, through you, Mr. Chair, I really wasn't intending to talk about specific sites, but I can talk about the specifics of that transect that this site is located within, and it is most certainly expected to experience growth, much more than the environics data that we have right now that we're reporting on. And I would expect that we are going to propose or project a need for additional facilities, be they indoor or outdoor. And I would suspect that given the size of the property at 1010 and its strategic benefit from a recreation asset perspective, that recommendations would eventually come out post approval of our plan. When I talk about DC, when I talk about everything from a recreation asset management plan to other strategic opportunities we have to talk about once the plan is approved, we need to look at how and where do we implement things and what do we implement. And I think that 1010 would be a very strategic opportunity in the future, past September of this year.
Okay, thank you. Thank you, Chair. I appreciate that. I know that it wasn't about specifics. It's just, that's just such a glaring example of where we're gonna actually have opportunity.
Chair, on the note on specifics, Kevin and Selma will send out something to members of council so they can sit with you. And there are 100 scenarios that we've talked about today that are perhaps ward specific, perhaps transect specific, that an offline one-on-one discussion might be helpful, both in understanding it and how it fits into the plan or doesn't fit into the plan. So Kevin and Selma have committed to doing that, and we'll be getting something out shortly.
That's so helpful, and really do appreciate that. You've proven yourself time and time again to go the extra mile to make sure that we understand these policies. So we do really appreciate that. We have Councillor Kitts, please.
Thank you, Chair. Lots of great questions already asked by my colleagues, but I have one to add. The report briefly speaks to the collaborative partnerships that the city has with private and public recreational facility operators. The examples used are big stakeholders, larger facilities, colleges and universities, for example. So is there any room in the plan to establish partnerships with smaller stakeholders for programming, a Legion Hall for dance class, or a golf course for cross-country skiing program, for example? I think the pandemic exposed that these larger partnerships pose a liability when we get to hyper local and stay within our own neighborhoods. So learning from that, I guess, is it prudent and beneficial to build an opportunity for more flexibility into our plan?
Thank you, Mr. Chair. I thank Councillor Kitts for the comment or question. It's a good question, and you got me stumped briefly. only because as I think about it, and going back to the history as to what did we consider, how did we get there, what made part of our inventory, a lot of it came down to who do we have long-term agreements with that are something that we can use to establish something as a destination or a goal. And when I say long-term agreements, there's all sorts of long-term agreements we have in the city. Especially, when we think of parklands, we counted Mooney's Bay as an available facility for the city, but it's actually owned by the NCC. It's on a long-term agreement with the city. However, the small venues, the little item, we did not really truly look at that, and perhaps that is something that we could look at and consider during our consultations. And the reason why I say that is that I am familiar with some very small relationships we have, and do they count? Do they not? It is kind of in the weeds from where we were going from. Is it our snapshot in time as to what we have? And then when we talk about our future facility provision, perhaps a strategy, or at least a strategic statement to consider other properties if they're available for long-term arrangements. And we were very interested in long-term because our investments from an accounting perspective require a long-term investment. We would not want to invest in improving a facility to meet our needs for only a very short period of time.
Okay, no, that makes sense, but I think it would be worth exploring perhaps in the consultation phase, as you suggested, because I'm wondering if this is a missed opportunity with respect to providing more and better amenities. So food for thought, and I'll leave it there. Thanks, Chair.
Thank you so much. I do see that you have your hand up, Councillor Kavanaugh. I promise you I'm not skipping you. We're just going with the order that we had before. Councillor Fleury, please, for 5 minutes.
Thank you, Mr. Chair. And I want to begin by commending staff. It's a very comprehensive report that looks at transects, that looks at facilities, that looks at needs, that so many fronts. So I want to begin with that. My questions are more structural in nature as I've had an opportunity to meet with my community and staff on it. So I want to go back on it. I want for the record to raise two anomalies in the report that I know Selma and the team will be working on, but just to make them hold. So on page 70, there's a reference to rec complex centers. There is an error for Lower Town. Lower Town complex is not a complex. The only thing you can rent at Lower Town is a pool. So I understand that to be a reflected change.
I'm not sure if that was the end of the question, if we've lost the councillor.
He's
I think
frozen.
we've lost. I think he's frozen. Councillor Fleury, if you can hear us, you've frozen on us. Okay. I guess we'll give him another 10 seconds here and come back to the councillor should he regain his internet. This totally happened to me at Fedco the other day. Oh, we've lost him. There we are. Okay, we'll wait for, oh, I think Councillor Fleury's back. Are you with us, Councillor?
I am. I'm tethering from my phone. Where did I freeze?
At about 1 minute by my timer.
Okay. So did you capture the anomalies, the two sites anomalies that I was raising?
We got page 70
yes.
for Lower Town Pool.
Yeah, and then there is the turf, which is in Councillor Menal and I's area, which is owned and operated by the University of Ottawa. I'm going to turn off my my video because I don't think you can. Can you still hear me?
Yes, we can.
Yes. Okay, I'm seeing you. Perfect. So Dana, I want to maybe take a big step back because this is a master plan. I've been on council now for over 11 years, and we had a plan. So we had a plan. It's work. The plans work. We built a number of facilities in newer areas, which is great. Those are great facilities. Good examples: Minto, Richcraft, François Dupuis. How does the plan that's presented to us, which is a master plan, reflect kind of the period before that plan? So we had in newer areas, which created additional deficiencies since amalgamations within established neighborhoods, which have seen growth. So how is the data captured in the plan reflecting of that?
Kevin, do you want to go on this one, or?
I'm happy to start, Dan, but you're welcome to interrupt me as much as you want as well. So the data in the plan right now is our snapshot in time as of this year. It doesn't. We did not look backwards. We looked forward because it is about growth. And when we talk about growth, if I look at growth since amalgamation, there's actually sections of certain communities have shrunk since amalgamation. Some have grown. Some have gone from 0 to 100. When you think of greenfields. So it was best and wisest for us to proceed based on a snapshot in time as to where are we now, what's our service level provision, what's our growth going to be, which big asterisk there, of course, since we're waiting for the actual growth numbers. And what does that mean on a service level provision when we consider growth, where are we going to go?
Dan, did you want to add anything? Sorry, I didn't want to.
Councillor, only to say that the other piece of that, and we've discussed this, is we don't yet have, and we're not sure whether we can get transect population growth going from 2001 to now. We are asking to see if that is possible. We've seen it for some on a ward basis for some wards, but not on a transect basis. But one of the things that we will look at is if that data is available, whether it's possible to summarize and capture that as part of the plan to give the longer run view of what's happened in the various areas of the city. The other thing I can say is that the plan that we have now, the 2004 plan, everything but one building has been built on that. Everything except the Riverside South rec complex has been built. But it's important to note that in addition to everything that plan identified, a lot of other things were added on that weren't in the plan, but came along and qualified for other sources of funding, because we are talking primarily about planning for growth and growth funding. Things like senior level of government funding, strategic funding on the city side. And I know, the community safety and wellness plan has been mentioned. Part of that, I think, is going to be, well, I more than think, we have been discussing how recommendations coming out of that can help focus other sources of funding, or providing an overlay of priority to this funding, to growth funding as we move forward. So there are other things that are going to come in and help impact, what the priority spend in terms of projects are going to be in the years to come.
Yeah, I think the plan is tricky in some respects because it's a master plan and there's a growth component to the master plan, but we can't forget that there are standards, efficiencies. There's a number of elements within a master plan that need consideration. And I think on a number of fronts, if you look at, say, page 30, or on page 188, where there is a recognition more captured throughout the report. We heard from a number of stakeholders today and through email on prioritizing multi-sports facilities. So when you throw a splash pad in the mix versus a gymnasium, like every time we should take a gymnasium for the context of the amount of use that could get out of that in most contexts, right? So I think there's those elements as well. My final question to you is going back full circle on the asset management. I want to understand there's a few elements that we continue to refer back to the asset management plan. And I'm going back to the Champagne again. I hope that I can give a little more clarity on this. So if we use Champagne Bath as an example, it's a historic building. If asset management was to come in and do repairs, how does it ever come to standards? I don't understand, because Kevin says, well, asset management plan will address the growth in the standard or the need. And then when I speak to Jen, because Jen's given me a real good briefing on the asset management plan as a whole, not just recreation, I don't see those dots connecting. So Jen, maybe I could say, if there is to be a roof replaced, say at Champagne, does that bring in a six corridor, 25-meter pool?
So, Chair, through the master plan and then later through the asset management plans, we'll get a better handle on the level of service that we need and can afford across the city by transect. So intensification is a key piece to our growth strategy, and it's going to put more pressure on our existing assets for sure. So our ability to meet levels of service will need to be a collaboration between renewal and growth so that we can determine how best to provide these amenities, be it through a renewal, a rebuild, or a new build. But that perspective has to be on a transect level, at a higher level of looking at how we can best provide that service. And it may or may not result in specific investments in specific buildings. So it's a question of looking at what problem are we trying to solve and what the best and most affordable and most effective way to provide that level of service is. So part of that analysis involves looking at the existing asset base and what can we reasonably do with it and what other options are available for us. So this master plan that Kevin and his team is presenting today is a very, very important first step in the journey to establish what that kind of proportion is or ratio is, and then we can build upon that going forward.
Councillor, I'm going to give you a little bit of an allowance here because of how awful your connection has been. I think that that's fair. So you've got another minute. So please go ahead.
Okay. So thank you, Chair. Jen, coming back to you. So what would it? I hate to give the example, and I will repeat it every time because I'm not here to give my example in my ward. That's not. I'm not asking for you to look at Champagne specifically, just to be clear. But I'm using Champagne to give an example. So what would it take from an asset management point of view to get an upgrade to Champagne pool, say to a plant-like facility? What's the AM considerations for that?
Okay, so we're still a long ways off because we have not started the, sorry, Chair, we're still a long ways off. We have not started the analysis yet, but it will be coming and it will be an evolution. So what it would take is a look to see what the overall needs are. So what is our level of service? What's our target level of service? What do we currently have in place? Are we meeting those targets? Are we not meeting those targets? And if we're not, what do we need to do to get there? So I can't tell you specifically today what we'll do or not do at Champagne because we have to look at it at a citywide perspective and in the context of what the overall level of service is.
Okay, maybe my last question really refers to back to Dan. So Dan, there's a number of data, there's recommendations we talked about, and some colleagues raised the issues relating to we can't treat every pool equally because by the age of the asset, the standards have evolved and changed. I'm using pools, gyms is another one. Like, how is the team going in the review over the summer, engage on and bring back some consideration to some of the standard deficiencies? Because right now, if you look at the map, it looks impressive because there's stuff all over the place. But the reality of some of the facilities we have is they're not meeting the community's needs for programming. They're not meeting the spaces requirement to achieve, say, the gymnasium space or the pool space. So I'm curious to understand how that data, and maybe tie in the second piece, which is right now there's recommendations in this report, which are based on values that Kevin is telling us are just kind of brief. So how should we interpret that as committee? Because when the councils look at this, they say, oh, I'll get a splash pad, or I'll get this, or I'll get upgrade to that. I think from what I'm hearing, it's dangerous because you're saying this is just a rough estimate. So can you maybe give context to those two elements?
That's time, but we'll turn over to staff to provide a response.
Sure. Chair, just to reiterate something I said at the beginning, that the numbers, the per capita numbers are preliminary and will be replaced. And accordingly, the recommendations that are in there are based on the data we have, but will likely change. Maybe not all of them, but probably enough of them will change based on updating the data and doing an analysis of that, what that data tells us. What we heard about gyms today is that perhaps the approach that we took of including them as part of the community center or community complex counts wasn't sufficient because it seems to be a more acute and well-defined need in the community. And so we've undertaken to go back and take a look at that and provide a separate analysis of gyms. And I think that will give a clearer picture. We'll have to put some thought into pools. We will collect, and I'm sure we will hear in the second phase of this, and no doubt if we do individual councillor discussions, the deficiencies of things like pools and community centers and the existing stock. We will document that. But just as a reminder again, that when we come back, we are not going to make specific recommendations to widen the pool or increase double a gym or that a specific site thing, because this report doesn't take that to that level. However, we will capture all of that as it comes to us And as part of the next pieces of that, of looking at individual assets and within transects, we will, we'll find a way to incorporate that into the deficiencies of those specific facilities. Deficiencies in terms of the transect level, and Councillor, we discussed this earlier this week, I believe. We will look at taking the current provision rates per transect and identifying some of the gaps that we're aware of by transect, so that stands out a little bit more clearly when we come back to you in September.
Okay. Mr. Chair, I do have two directions. Do you want me to come back on to read them out?
I mean, I think that you're the last person. Does anybody else have any further questions to staff? Anyone?
I thought Councillor Kavanaugh was at. Did I miss it?
Oh, that's right. Sorry, I'm so sorry.
For a long time. We've been back and forth on this.
I'm glad to get back on. I'll get back on, Mr.
Yep, sounds great. Go ahead, Councillor Kavanaugh.
Thank you. It's been a long meeting, and I know I'm between you and lunch, but I think these are important topics. Thank you. I really, really appreciate all the work that's been put into this report. Just the numbers, just the maps alone are extremely useful, just to know the density and the fact that it's going to be tandem to the official plan of how we plan our future. I can't help but think, when I think of the official plan, I can't help but think of what amenities, infrastructure we need to go along with it. And this helps. The first thing you do is find out what you have already and map it out and look at it and look at the needs. And there's two major features here. When we talk about density, we need more infrastructure, and I appreciate that you're looking at that. And I appreciate the neighborhood equity index priority areas that you've pointed out. I think those are very important, and that's very helpful. So in terms of going forward, the comments about basketball is, I can say that I agree, because the only one in this area, and we're in a community area that is a priority, is Michelle Heights has the only gym that's indoor basketball. Foster Farm, for example, is totally inadequate because it's got a false ceiling, so it's no good for adults. It's really problematic, actually. And we just talked about mental health. This is mental health. This is something that is towards mental health. So we do need those facilities, and I appreciate the outdoor facilities as well, but they will be needed. So I can concur that that would be important. So I just wanted to comment on a few things. There's sort of two levels here. There's the macro level of major things that we need. The indoor pool, 50-meter pool. I'm looking for it, man. I'm looking for it. Can't wait for more pools. But also the micro, what's in that 15-minute neighborhood. And that is really important. The low-hanging fruit sometimes of some of the things that we could do reasonably quickly to help our communities, such as those skateboard parks, which we're going to put into Bayshore based on CIL money, things like that. Those are really important and help us along the way. One of the things that I was puzzled about is no mention of field houses, and they're kind of de facto community buildings, and they're basically in the older areas. They've kind of outlived their lives as field houses for just changing into your skates or using a bathroom. People want a lot more, and we're moving towards more community buildings. On your projection, you only have 2 more community buildings projected. Perhaps you were talking about new ones, but I wanted to get a comment about the conversions of field houses. And I know that you had in your presentation that that's not what you're dealing with, but they are there. And we're talking about the areas where we're expecting a lot of density and how that can fit into a 15-minute neighborhood.
Evan or Salma, do you want to comment on the field house aspect? Because I know we did
Yeah.
discuss it at one point.
Yeah, I'll start, and Selma, you're welcome to jump in as well. So regarding field houses and community buildings, recall we mentioned that they exist. They're part of our snapshot in time. We recognize that they're there, and then you've heard Jen Nielsen speak about as things get old and potentially need replacement, we'll have to look at our service level provisions and that. So um, uh, as growth occurs, these are also items that would be potentially subject for expansion as well, due to growth, and it all depends on the nature of the growth, the volume of the growth, the condition of the building, and that is part of would be part of a recreation asset management plan, but also part of our growth plans as well. When I say growth, it doesn't necessarily mean that and when I think of, for instance, what happened at the Overbrook Community Center, through growth, we added a gymnasium to that center. And that was to reflect the fact that there had been growth in the neighborhood and that more space was needed and a gymnasium was added. The same comes down to field houses. Right now they're small, they're single purpose. They are basically a park support building, for lack of a better term. But as a community grows and expands, the need for additional community indoor space may require an expansion to that center. And that is the nature of what we're talking about today. Is it truly is as we grow, what more space is needed, and that's what we're trying to address. And that does speak to your field houses in the sense of over time, especially as more people come into a community, the demand on a small little field house, which for committee's understanding is basically, two main rooms, which are change rooms and bathrooms and some small storage. That's really all they are. To have expansion for multi-purpose community indoor space is what becomes the need, and that comes with growth, and that is what we're trying to address here through our saying that as we grow, we need more space. And again, I'll come back to it. We really do need the growth projections.
I appreciate that, but I think we specifically have to talk about those field houses because they're all ancient and they're all in areas that I think almost all of them are in the inner urban areas where we're seeing the growth, and so they now need to fulfill a different purpose. Some are successful, have already made the transition, like McKellar Parks and Nanaimos, but we need more of these in terms of a 15-minute neighborhood to have those programming right in communities, so it fits right in, and you can get a lot more help with in terms of community involvement because they pitch in more. So the cost is lower in terms of working on programming, et cetera. But we're not talking about programming today, but in the overall cost versus a very large center, which serves its purpose differently. In terms of of a large center, I hope that we're going to look at access to the rail line, our new to transit, when that is being looked at, because I think that we have to move away from those big facilities out in the suburban areas that are completely built for driving to. And I wonder if that's going to be included as a factor. I know this is early, but I think that has to be said now, that we have to have places that are more accessible that in terms of getting to it in different ways. Is that
that's your time, and if you'd like to go for a swim with me at Bob Macquarie, which is co-located with Jeanne d'Arc Station in the East End on stage 2, I think that that would be a lot of fun. But please go ahead, staff.
Thank you, Chair. And I won't go swimming with you at Bob Macquarie simply because my lifeguarding days are over. Anyway, if I may, to respond to Councillor Kavanagh, part of what you're talking about is actually not necessarily what we will address in this plan. The official plan actually comes with recommendations about where major recreation facilities are to be located in proximity to transit. Last I saw, it is suggested that we be in relative proximity to 400 meters. We asked official plan team not to make it 400 on the nose, but to be close to 400, because if it's 401, do we need an OPA? We were just trying to be obvious. We received direction from OP for the location of our major facilities from an OP perspective, and that is where they are talking transit. Our plan does not speak about transit. We don't talk about how close any of our facilities need to be to the bus stop or the train stop. What we do speak about is what that facility needs to be when serving population, and where it needs to be in regarding to a transect service delivery as well.
Okay. Is my time up?
It is indeed. I definitely gave you quite a bit extra there, just so you get your question out.
Oh, I'm bursting. It's my favorite topic. Can I go back on?
Yes, of course you can.
Okay, thanks.
Flying in like Han in the Millennium Falcon, or I would prefer Lieutenant Commander Worf in the Defiant, we have Councillor Glenn Gower, who I know has been with us for the whole meeting. Please go ahead with your questions.
Again, at the last minute with the question. Okay, I have two things. I guess one is a comment. I was very glad to see cricket specifically called out in the report. I do think there should be a more aggressive target for adding cricket fields, but it's a comment that I wonder what other multicultural recreation activities have not been captured by this report. And I mention that because we're actually in the process of having a cricket field built in Stittsville, and the local cricket playing community was incredibly happy to hear this news. But I find often when we do park consultations in our ward, we see very good representation from the organized soccer leagues, the organized softball and baseball leagues, the organized hockey leagues in the case of ice time. But the organization isn't really there for some of the other leagues that are up and coming or aren't considered traditional here in Ottawa or in Canada. So a comment that I suspect there's probably other multicultural recreation and park needs that haven't floated up to the surface. And I do think there's some more consultation, investigation, and outreach required to identify these. The question I want to ask, though, is about outdoor recreation that's not programmed. And I didn't see a lot in the report, for example, about walking trails or cross-country ski trails. It mentioned woodland parks, that woodland parks will be considered after all other facilities are built and accounted for. Whereas we have 2 woodland parks in Stittsville that have been incredibly successful and popular with residents. So were these outdoor facilities considered out of scope for this report? Or is it something that could be considered in the next iteration of it?
Mr. Chair, thank you for the question. And to respond to Councillor Gower, the thing about trails that we always want to consider is that they occur everywhere and anywhere. It's not just on what is called city active parkland. For instance, think of storm ponds, think of environmentally sensitive areas. I know in your ward, there's a rather significant woodlot that has gone through, let's just say, some major effort to deal with emerald ash borer and other problems that have occurred in it. None of those lands are the ones that are actually considered as active parkland. So we were very careful when we were talking about trails. And only in the sense that trails are occurring on properties that are not stuff that's subject to this report, but are actually subject to the green space plan as part of the official plan. We are focused solely on active parkland that we can program and use. So we don't even bring in, for instance, schoolyards, stormwater management facilities, environmentally protected areas like specialty woodlots. Ravines, all of that is outside of our purview. The greenbelt isn't even considered by us. Lord knows we wouldn't want to consider the greenbelt because our provision of parkland per population would be ridiculously large. In fact, the greenest in Canada. We only look at stuff where we can build something like a basketball court, a splash pad, a children's playground. Trails can occur. And if it happens that as a woodland, for instance, comes available during the park development process, we of course consider it, and it will get trails or pathways through it, because we would always encourage a formal path through a woodlot rather than the informal paths, because they cause damage to the actual woodlot. But it is not a primary focus because we need flat open space to develop things like a sports field, a splash pad, a basketball court. All of these things was our primary focus at this time. But trails we completely recognize and are especially important under the Green Space Master Plan, as well as when you think of trails, if you think of it all the way up to a multi-use pathway, it comes under the transportation plan as well.
Okay, thanks for that context. I do wonder if considering them though as parks and recreation might open some other doors for funding opportunities. But I will leave it there, and I would like to follow up offline just to discuss this a little bit more. Thank you, Chair.
Thanks for joining us today. You're always welcome. I was just kidding. Back to Councillor Kavanagh, please. Go ahead.
Oh, thank you. I thought Councillor Fleury was going to come back on too. That's great. My question is about wading pools. All of them, there's not going to be any new ones. That's unfortunate. I really do believe they're important for learning how to swim. And they're mostly in the older neighborhoods. They're not in the newer neighborhoods at all. And I think that's sad, but I know that it's related to cost because you have to have lifeguards, et cetera. You need facilities, but I hope there's opportunities in the future to consider them. But in terms of the ones that are there, what kind of timelines are we looking at? Because most of them are well over 60 years old. And we've had issues with some of them, but in terms of renewing, what kind of timelines are we looking at?
I may need to refer to my colleague Jen, but they would certainly fall under the Recreation Asset Management Plan for consideration. Yes, they're old. Yes, they need to be thought of. And I'm sorry, Jen, I'm probably taking wind out of your sails, so I'll shut up now.
Fair. There was no wind taken out of my sails, but thank you. So I would have to look into it and get back to you, but it would be identified in more detail in the Recreation Asset Management Plan.
But we have the funding for that. This is not something that we need to have federal grants for or anything like that.
No, it's part of, Chair, it's part of our regular infrastructure funding that gets allocated across existing infrastructure, including those wading pools.
Okay, thank you. Appreciate that. In terms of things like BMX, mountain bike parks, skateboard parks, there's only one that is being recommended, but I assume that's a large scale one. Is it possible to have smaller ones like community run ones as well?
Through you, Mr. Chair, yes, the recommendation is for one of our larger regional scale type of parks. The smaller ones, the community-based ones, are typically occur as opportunity arises. They don't need to be necessarily selected from growth. And if I saw Councillor Gower on here earlier, for instance, where we added a small community specific skateboard park during a new park development in his ward. These are things that we look at opportunistically as time goes on, because it depends on the nature of the site and the nature of the demand. But given demand and the regional scale parks, those are the large ones that really need an investment, especially from a DC perspective. Our most current project underway, or well, at least under design, is a major installation to now occur at the Bob McCoy Recreation Complex that would be similar to the size of the installation you see at the Ben Franklin Place in Centerpoint area.
Okay, thank you. Yeah, that's what I just wanted to make that clear, and that's good to know. The NCC is throughout our city, very prominent in my area, and there's opportunities perhaps to borrow from them. You know, Mooney's Bay is a long-term agreement, but some short-term agreements, like if for areas, you have a community where there's no park or just one pocket park, but they have tons of green space beside them that's NCC. Is there possibilities of making arrangements? Some informal arrangements have been made with some of these areas. Are we looking at that? And these are areas that are inner urban that are targeted for intensification.
Through you, Mr. Chair, any opportunity that comes up with the NCC, we would be happy to investigate. I don't have any specific ones front of mind at the moment. Any engagement we have with the NCC, I would only suggest is rarely short term. Actually, the discussions are often long term. But to that end, if there is an opportunity for recreation on NCC lands, it would be typical for us to consult with the NCC, make a proposal, come up with an arrangement, and take over operation and maintenance of an area and management of it and development of it. It's not simple, but it's also not impossible either.
Thank you. One last question, and that's on arenas. The one pad, the single pad arenas. I understand that the costing and you know, maintenance, etc. But then there's there's an efficiency when there are larger facilities, but that goes against what we talk about in a 15-minute neighborhood of having things close by and local. An old facility like Belltown is older. It's historic and wonderful. But what are the futures for places like this? Because we need to keep things in the community as well.
Chair, very much council asked us to look at this and to see if, well, a couple of things. One, to deal with the aging infrastructure and whether we can spend the money more wisely by looking at creating newer multi-pads. Some of these are very old, and Belltown Dome is perhaps one of our unique facilities in that it's an odd building at best. The future for these, I think, is still something council is going to have to decide on. Twin pads, though perhaps not the 15-minute neighborhood model exactly. We do know that most people who go to arenas are driving, that they're bringing hockey gear or they're bringing skating gear to the arena, and that certainly when we did some public polling on this with respect to how far people were willing to drive, and I don't recall the numbers, but I think it was in the 20 to 25 minute range. So people did not expect to necessarily walk to the arena to play hockey or ringette or whatever it is. So we're going to have to decide if we want a model of twin pads. Then arenas are already not the kind of facility that every neighborhood can have. We don't have the need for that many ice pads, and we could never sell the ice in that kind of a model. But you are correct in pointing out that we're going to have to make a decision of whether we want to, and this will likely come when we have our first opportunity, when we see that there is an opportunity to build the twin pad and to possibly repurpose 2 or 3 existing facilities. And we talked about that earlier, that might be for pickleball courts or for ball hockey in the summer or for a year-round skateboard park. But so that's what's behind it, is to move to a more efficient replacement of what is eventually going to fail. And we're not quite there yet. We've put that on pause so that we can have a look at all of the other impacts that COVID has brought to us.
Okay, well, it's a historic building. It's a special one. One last question. In terms of what we're talking about today, where does storage fit in? Because a lot of times our buildings are being used for storage and not necessarily for activities. And how is that going to be dealt with in the future?
Councillor, through you, Chair. We are working with our, and this has been a long-standing issue ever since the new city. You are correct that there's everything from hockey teams storing equipment in our arenas to the one you're familiar with of a baseball team using portions of a field house. This is pervasive. I think there are at least, and I think at last count, about 1,500 small community agreements of storing things either in city facilities or on city land in various bunkers. And under a whole range of different scenarios. We're doing it for free. Some are doing it at a prescribed rental rate per square foot that the Auditor General had a look at and said that we should revise. And our real estate folks have done that. So at some point we need to come forward and bring some rational approach to this and what the go forward is. I can tell you that in the last 5 years, we have been very unreceptive to taking up more storage space in prime facilities. And I can't recall really having approved anything of significance, simply because it got away on former municipalities through a whole variety of formal and informal agreements. But it really is difficult to justify prime community space for rentals. For dead storage, and we do. It is an issue that we need to resolve as part of that. This isn't part of this specifically. When we build facilities and the facility standards that council approved before about a year ago, does include storage requirements, but they are our own storage requirements. It's simply not affordable to offer community storage to any great extent, and the demand way outstrips what we could ever supply in an equitable manner.
And so at what point are we dealing with that, if it not now?
I don't have the timing, Councillor, but we could take that offline with you and provide you an update after we talk to our colleagues.
Thank you. Thank you, Chair.
Thank you very much, Councillor. Over to Councillor Fleury.
I'm back on with some visual, so internet's back. Mr. Chair, I did work with staff, and I really want to thank Dan and his team. I did work to bring, as you know, this is a draft version. We're going out to consultation. So I did draft some, sorry, I have to find it. I did draft some staff direction. Is it appropriate to read them?
Yeah, please go ahead and read them.
Okay. As part of the Parks and Recs Facilities Master Plan, one, explore best practices for reflecting population context beyond residence population, including workplaces, for proximity areas to regional amenities, and consider population growth since amalgamation. And two, analyze, consult, and report on facility deficiencies per transect, pools, arenas, gyms, and fields specifically, while also considering the Ottawa Neighborhood Equity Index when determining priorities.
If it's okay with you, I think that we'll deal with them one at a time. So I appreciate you reading that out. And I'm wondering, I mean, if you want to speak to that, or we can have staff let us know whether or not this is something that they can support. That's up to you, Councillor.
I can speak to it, but I'm glad to turn the floor over to Dan.
Mr. Chair, Councillor Fleury is correct that we have over the last week discussed this and landed on the two directions that he is providing with to staff. So we will do our very best to incorporate the points that he is bringing forward. And we talked about some of those. I think I mentioned we would look at Toronto and other areas to see what they are doing. So we will roll that into both our own work and into the consultation process to and try our best to reflect that in what we come back with.
Okay, it seems that staff support. If it's the will of the committee, we will provide that direction to staff. Everybody thumbs up. Okay, and your second direction, Councillor, please go ahead.
Oh, I read them both, so I thought Dan was speaking to both.
Yeah. I was speaking to both.
I'm sorry, I only heard the one, Councillor. My apologies. My apologies.
Okay, it was maybe too short.
I think that's probably what it was. I thought it was 2 points on the same direction. My apologies, Councillor. Okay, that's great. Anything further, Councillor Fleury? No? Any other members of the committee wish to speak on this? Oh, please go ahead, Councillor El-Chantiry.
Just quickly, and I know we had a discussion with Dan before, but I heard you talk about the single arena. But as you know, we had the discussion with you and your staff. In a rural area, I think Councillor Kitts, myself, and Derues and Moffat, I mean, we can only have single pad. We don't have the population to support twins. Mind you, we do have 2 arena in the ward, but not necessarily be able to twin. So what would be the future of those single ice pad in a rural, or maybe Kevin had his hand up. Well, we talked to Kevin about it. Anyway, Kevin or Dan, I'm good.
Mr. Chair, I can say that as part of the arena optimization initiative that we laid out for council, we had no intention of looking at rural arenas for any of this. The idea was where there is a concentration of older facilities, we fully recognize that most of the rural arenas are the community gathering place, often have an attached hall, are part of the fair, community fairs. So that is not the priority. The real focus of this was primarily inside the Greenbelt.
If I was to add any one point, Councillor, it's that the function of a rural arena from a multi-purpose perspective is far wider than the multi-purpose use that anything we would achieve inside the urban area for a single pad arena.
I was just hoping to hear what I heard from you before, and I just heard it, so I'm happy you're consistent with your message. I really appreciate that. Thank you, Mr. Chair.
No problem, Councillor. Do we have any further questions to staff? Okay, great. It's been a long day, friends. Is this report carried?
This is a received report, Mr. Chair, I believe. I don't think there's recommendations here.
There
Received.
I think it's a received.
Direction.
Received.
Okay, fair enough. Received it is. On the previous one where we received it, where we said received, it was actually carried. We were supposed to carry it to council to be received there. So
carried.
A little bit. Yeah, there we are. Whatever. Okay, good. We have no in-camera items today, and we've received no notices of motion for consideration at a subsequent meeting. And do we have any inquiries? Seeing no inquiries. Okay, do we have any other business? Wonderful. Seeing none, on adjournment, is this motion carried?
Carried.
We are adjourned. So thank you, everyone. Our next meeting of CPSC is scheduled for Thursday, June 17th. Thank you so much for coming out, and I will talk to you guys later, and enjoy some fun in the sun today if you can sit out there with your laptop and get back to residence. Wonderful. Take care.